Good afternoon and welcome.
Good afternoon, Chair.
Thank you, Senator. Welcome to the Senate Finance Committee. Today is Wednesday, March 6th. We will hear 8 bills today. Approximately in this order, it just depends on whether or not our senators have to go to other committees or late getting to our committee. But these are all Senate bills: 947, 950, 975, 930, 834, 998, 989, and 990. So that's 8 bills today, unlike 16 bills yesterday. You're all lucky you won't be here till 6 o'clock tonight. The sponsor has I don't think so. The sponsor has as much time as the sponsor needs to explain the bill, and all witnesses get 2 minutes. You'll see a clock on the come up on the screen. Please respect the 2 minutes because I'd like to treat everybody fairly. So everybody gets 2 minutes except the sponsor gets more. We're going to start then with Senate Bill 947. And Senator Kelly, thank you for being with us. And you have a panel: Robin Elliott, Pam Casemeyer, Lynn McGann, and Jakaya Johnson. They can all come up with you.
Oh, we can sit here? Sure. Okay. Yeah. I think we're all here. We're waiting for Pam. Pam, come on up. Wonderful. Thank you all. So this is Senate Bill 947. If you were reviewing this in your file, you probably saw it had no fiscal note. It's hot off the presses. I have not yet read the fiscal note, but I've handed it to Robin Elliott, who has had a chance to skim it for 1 minute. This is a piece of legislation that I got back from drafting just before the bill drop deadline. So it does have a sponsor amendment to clarify some language. It also has an amendment from me to add Senator Elfreth as a co-sponsor. So you should have both of those amendments. It's also just for the sake of the record, I wanted to have a as brief a hearing as possible since we're getting late in the session. But it is a Maryland Legislative Agenda for Women priority bill, and you'll see a lot of support testimony in your written file. Before we start talking about the substance of the bill, since the fiscal note doesn't include the amended language, the House version of the bill actually did have the correct language. So when they get their fiscal note, which will probably be very soon because their hearing is on Friday, you can certainly refer to that. But just so you know, in addition to the amendment adding Senator Elfreth as a co-sponsor, there's an amendment that makes clear that the fund that is proposed by this bill could be used in addition to security services, which is the language that's in your bill, could also be used for care for uninsured individuals and individuals unable to use their insurance due to risks posed by communication from insurance carriers regarding coverage, travel or related costs, and any other initiative to improve access to abortion care as determined by the Secretary of Health in consultation, et cetera. That's the language you have in your file, so you can refer to that. But just so you know, as we're discussing this bill, the intention was to submit the bill with both Senator Elfreth as the co-sponsor and that language in the bill. And it was only because of how busy and overwhelmed we are that wasn't dropped that way. I wanted to just talk to you for a minute about why this bill is important. And again, I didn't want to overwhelm you with testimony, but there is written testimony in your file from a woman I've known for many, many years. Her name's Allie Harper. She's the executive administrator for 3 abortion clinics in Maryland: Potomac Family Planning, which is in Rockville, Hillcrest Clinic in Catonsville, and Hagerstown Reproductive Health Services, obviously in Hagerstown. Her written testimony is very compelling, and I'll just read you one sentence. It says, "We are continuously examining new ways to ensure that patients, staff, and clinic escorts are safe. Our Hagerstown Clinic is a key example of the importance of security due to its proximity to a crisis pregnancy center and a location that allows for protesters to follow patients all the way to our entrance. While we cannot stop protesters from interacting with patients, funds from the Abortion Care Access Grant Program would allow us to invest in better cameras and lighting to allow staff to better monitor the situation inside and outside the clinic, and to coordinate with law enforcement as appropriate." So, that sort of brings home for this committee sort of why I'm here with this bill. I will tell you a little bit about what the bill does and where the funding comes from in the bill, because this is where I've been getting a lot of questions. The bill creates a grant program. That grant program would be within the Department of Health. It would improve access. It would create grants that would improve access to abortion care. So grants for security, for equipment, for capital improvements, for security staffing, and of course, those things that I listed with the amendment initiatives to ensure that people who are uninsured or who can't use their insurance can have access to care, as well as necessary wraparound services as determined by the secretary. I do think it's important. You have a letter in your file from the Department of Health. It's a letter of support. However, they do propose an amendment. So I'll read that to you, and I'm supportive of that amendment. They propose an amendment to include language in the bill that states the names and other identifying information of grant recipients, including abortion clinics, providers, patients, and potential subrecipients will not be released in order to protect abortion clinics, providers, and patients that are funded through the bill. So I do support that amendment, and I think that also brings home sort of the critical nature of the work that we're trying to do with this legislation. From my perspective, I think it's very important that this program be administered through the Department of Health. We're talking about people who are healthcare, who are seeking healthcare, who are then it's a politicized environment, but ultimately it's healthcare. And I think it's really important. And I think you'll hear from some of the clinicians, and you certainly can in your bill file, see why from our perspective, it's very important that this be housed in the Maryland Department of Health. So I'm thankful for their letter of support. Let me get into the financing. So this grant program, obviously it costs money to pay for grants. So it starts with $1 million allocation, but it would be funded in an ongoing manner through a sort of unique mechanism that this committee and this body really invested in sort of investigating over the last couple of years. In 2022, when we passed the Abortion Care Access Act, which was cross-filed with the former chair of this committee, Dolores Kelly, our goal was similar to the goal of this bill, to ensure that people had access to abortion care. When we passed that bill, we required a report from the insurance carriers. For this sort of explanation, I will refer you to the letter of information from the League of Life and Health Insurers. They sort of explain, back when we did the Affordable Care Act, it was required of, and I'll say this slowly because when I tell people this, they ask me to repeat it 3 times because they're like, the federal government did what? But it was required through the Affordable Care Act that insurance plans that were sold on the exchange collect a separate premium for abortion coverage, and that premium, which is $1 per member per month, be completely segregated and only used for abortion care services. In the 2022 legislation, we asked the carriers to submit a report to this body annually about those funds. How much were they collecting and how much were they spending? And we found that there were a tremendous amount of funds not being spent. And so that is what I am proposing be the ongoing source of funding for this grant program. So again, the League of Life and Health Insurers has submitted a letter of information. They are not opposing the legislation. And we do have reports. I meant to submit them in my written testimony, but I don't think I did. But I will make sure all of the members of the committee have a link to those reports from the insurance carriers to the MIA explaining those revenues. And I think Robin Elliott, you're going to talk about that more. Excellent. With her 2 minutes, she'll clarify a little bit more of this. But the important thing is that money is there, it's being collected. We have no control over that. That's part of the federal law. It has to be collected and it's sitting there not being spent. Meanwhile, we have this pretty urgent situation, and we have people who are here who can speak to the crisis sort of with funding for abortion funds and the fact that both our clinics need access to funding for security programs and our patients need access to care. So I think that we can move forward with this in a way that makes lemonade out of lemons, which is the fact that this funding is just sitting there, not being used by the insurance carriers. So I hope I have explained this bill to the best of my ability. I think the best thing I can do, I want to talk to you for 1 second just about the threat to providers. I read you Allie Harper's testimony, but just so you know, right, in 2022, abortion providers reported a 29% increase in assaults and batteries, a 100% increase in burglaries, a 913% increase in stalking, a more than 100% increase in bomb threats. This is a real concern that is really impacting people's ability to access care, which is why I'm here today with this legislation, along with Senator Elfreth. And I know you'll be hearing a similar bill from Senator Elfreth later in the day. It has its positioned slightly differently, but we are working together cooperatively with the same goal. This is the bill that would have it housed in the Department of Health, which I think is preferential to the clinicians who see themselves as healthcare providers. And I think that's where they would like to be. But with that being said, I will pass it off to Robin Elliott to get into the weeds as she does and be here for any questions you have about this bill. And I thank the committee for working with us on this important legislation.
Good afternoon, Robin Elliott. I'm here today on behalf of the Women's Law Center of Maryland and the American College of Nurse Midwives in full support of this bill. This body has done a tremendous amount of work to increase access to abortion care. But we are sitting here facing an incredible public health crisis because of the Supreme Court decision. As we all know, Dobbs pushed the decision back to the state on whether or not people could access abortion care. 21 states have banned abortion. And there are, as you'll hear, many, many people leaving their home states, going to safe states for abortion care. This has really created an environment that is next to impossible for providers to keep up with and to sustain. We do have abortion coverage mandated in Maryland. It is not enough. It's important, but it's not enough. Many people do not feel comfortable using their insurance, and that's because an explanation of benefits will go home to the person holding the insurance, who may be their spouse or a young adult that's still their parent. So what this bill does, and I'm happy to get into the weeds on the funding if people ask me questions, is utilize some untapped funds that are sitting there in the carrier's account that are not allowed to be spent for anything else. And so we have a crisis. There are unspent funds, and this is a very innovative way to move forward in Maryland. Thank you so much.
Madam Chair, members of the committee, I'm Pam Casemeyer, and I'm here today both on behalf of the Maryland section of the American College of Obstetricians and Gynecologists and the Maryland Academy of Pediatrics. I won't take up a lot of your time because I'm not sure I can improve upon any of the information that was provided by Senator Kelly or Ms. Elliott. But on behalf of the providers who are often involved or are the ones providing these services, the security issues are significant and the demand issues are growing. And because we have this already existing source of funds that can't be used for anything else, and because of the commitment the state has already made to providing these services and providing access, this seems like a very smart way to begin to enhance and protect the services we have already said are important to be available in the state of Maryland. And on behalf of the providers who we represent, their safety and security is something that they do worry about more and more over time, and as well as those for their patients. And for those reasons, both the Academy of Pediatrics and Colleges of Obstetricians and Gynecologists would urge a favorable report.
Good afternoon. I'm Madam Chair, members of the committee. My name is Jakia Johnson. I'm the Executive Director of Reproductive Justice Maryland. And at RGM, we're dedicated to championing reproductive justice as a fundamental human right for all Marylanders. And we believe that Senate Bill 947 is a crucial step towards ensuring the safety, security, and accessibility of reproductive health care in our state. This program is not just about providing financial assistance for abortion-related expenses, although that is an incredibly important part of it. It's also about recognizing and addressing the barriers and threats that individuals seeking abortion care face, particularly in the form of harassment, intimidation, and sometimes even physical harm directed at them, their providers, and advocates. Reproductive health care facilities should be places of safety and support where individuals can access the care they need without fear or interference. But far too often, these spaces become targets for harassment and violence, and just an atmosphere of fear and insecurity for both patients and providers. So by investing in security enhancement, we can help to deter harassment and violence and ensure that individuals can access abortion care without fear for their safety. And by using funds that already exist under the Federal Patient Protection and Affordable Care Act, the program will be sustainable and meet the needs of Marylanders for years to come. And for those reasons, we strongly urge a favorable report for Senate Bill 947 as an investment in the safety, security, and accessibility of reproductive health care in Maryland. Thank you.
Good morning, everyone. My name is Lynn McCanya. I am the co-director of the Baltimore Abortion Fund, which is a nonprofit that provides financial and logistical support to help people access abortion care. That includes Maryland residents from all 23 counties, Baltimore City residents, as well as those who are increasingly forced to travel for care. As costs and demand skyrocket, our statewide network of abortion funds, clinics, and providers who facilitate access to abortion are really being pushed to the brink. Our organization operates a confidential helpline that supports people with abortion care costs, travel, hotels, childcare, and more. Call volume was already rising post-Roe. Last year, it doubled again. Last month was one of the busiest months on record for our organization, and we were forced to close our helpline early because we ran out of available funding for that month, which left dozens of calls unanswered. We strongly support the establishment of the Abortion Care Access Grant Fund, which would provide a sustained and critically necessary source of funding for our organization and others in our movement to continue to address this ongoing public health crisis. However, we urge the committee to consider an additional amendment in order to fully meet the needs of people who are seeking abortion care. The amendment would be to expand grant eligibility to include people who have some form of insurance that is not fully meeting their needs. That includes both Maryland residents and people who are traveling from out of state. It may surprise you to hear that actually more than 10% of the people who call our helpline have some form of insurance that is either unusable or insufficient to cover the cost of their care. That includes Marylanders with federal insurance, like military TRICARE, that prohibits coverage of abortion care services. And it also includes many people accessing abortion later in pregnancy. So long as abortion remains out of reach for thousands of people in Maryland, including our own state residents, our status as a sanctuary state remains a hollow promise. I urge the committee to both support this amendment, this proposed change to language, and support the bill as a whole. Thank you.
Thank you. I have a question for the sponsor.
Yes, ma'am.
I'm reading a little bit about the HIDE funds, and according to a 2017 bulletin issued by the Center for Medicare and Medicaid Services, funds must be used only for abortion. It's a restriction, and I'm concerned that you're
Thank you for that. Yes, so this is in the letter of information from the League of Life and Health
well, I'm
Insurers.
also reading it on the internet. So
Yeah,
it's not just from
the CMS guidance is real. I think our interpretation is that the funds can be used only for access to abortion care. And so what the League of Life and Health Insurers is asking for is some clarity. I think the way we can approach that is by adding simple language to this legislation that makes clear that it would be as allowable under federal law. We have a lot of optimism that the current administration shares that interpretation, but we do want to make sure that the statute would have flexibility if the federal landscape shifts, which may very well happen. So of course, that suggested amendment is one that we're working on to get the language just right, but I have every intention of including that so that we wouldn't be putting into statute anything that would be in contradiction to the CMS guidance.
because it sounds like you could really risk and lose the
Absolutely.
funds.
We
So
would not want to do that. So again, we've done this in the past on other legislation. So we're working with council to figure out how to get that language exactly right, but it's something to the effect of as allowable under federal law.
So we're waiting for an amendment.
Exactly, yes.
Thank you, Madam Sponsor. Senator Reedy?
Thank you, Madam Chair. So I this could be to anybody, but to one person. Maybe Robin or the sponsor, but probably Robin may want to ask about this. So this is for capital or operating, and if it's to operating, is it to help a clinic operate, like stay open or be open, or is it for building additional security? I mean, what is this going to be?
So on the security grants, it's really both. So on the capital side, abortion providers are in a different space than other providers. They may need bulletproof glass. They may need to modify their building so that, as Senator Kelly read, there's a bit more of a sheltered entrance for patients and their families to come in. So those are some of the capital needs that providers have. On the operating side, providers may need security staff. They may need cameras, which wouldn't qualify as a capital item. And they may need some consulting services. I mean, one of the things providers have been doing, but we really have to look at all of our options, is how to coordinate with local law enforcement to ensure that they are safe and their patients and providers are safe. So it's written with enough flexibility so that the secretary could work with the provider community to help determine what's really needed.
For the medical firms that oversee these clinics, so they're not tied. So these clinics are not tied into a hospital service or to any sort of healthcare provider that oversees them or provides any covering for them. I'm just curious how that works here in Maryland. I'm sure we have some independent ones, but also like there's Planned Parenthood. They operate a number of these clinics. They don't have. This is not something that they work with their clinics on providing.
So providers certainly are trying to do this to the extent that they have the funding available. But if we think about how healthcare reimbursement works, it doesn't have a component that really recognizes the security needs. And because we don't have that issue with any other service. So I think to the extent the providers are able, they are doing this, but many are very, very stretched. And they do not have the capacity to do this themselves, which is why we hear about situations like in Hagerstown, which is where I grew up, and I know that clinic well, and that situation existed many years ago. It's been decades that they've dealt with this. So this is really going towards what their unmet needs are. It's also why the secretary serves such an important role. And we really think the Department of Health understands healthcare providers and will be able to work with them to assess what they need. We really want to make sure that reproductive health care remains as healthcare and that is not marginalized despite what is happening in the national landscape.
What is the number of abortions gone up in the last year or two in Maryland? What level are we at with the number of abortions that we've had in the state?
So there is an organization called Society for Family Planning that is actively monitoring the impact of Dobbs on state numbers. And as you can imagine, it's a little bit it's fluid because the landscape is changing. But in their last report, which was issued at the end of 2023, it looked like the number of abortions in Maryland were going up by about 500 a month as compared to pre-Dobbs. And so we are seeing an increase just as other states are.
How do they count that? Because we don't keep statistics on abortion in the state.
They survey providers that they have close relationships with. Many of these providers are members of the Society for Family Planning, as am I actually. So,
and the last question, thank you, Madam Chair. So, like, I guess the challenge, I'm interested in hearing more about this dollar fee that we've been charging for this period of time. But, you know, Planned Parenthood received $1.54 billion from Medicare, Medicaid, and CHIP last year, and $148 million in HHS grants from the federal government. I have a hard time. We've already set aside millions of dollars in the state for training providers. And we've set aside millions of dollars. We, of course, Medicaid funds abortions that are very, you know, we spend millions of dollars funding Medicaid abortions. It's just very hard to say, okay, now we're going to continue to do. I mean, at this point, why isn't the state just opening clinics on its own?
So there are two items to think about. The first is that this is very much under the Secretary of Health, because the Secretary of Health will be assessing what each provider needs, what resources they have available. And it's more than just grants. It's also helping our state take a public health approach to access. The second item, just to note, is that because of federal restrictions, there are no public health grant programs for abortion care that we see for other kinds of care. So the state, using federal dollars, does breast and cervical cancer screenings, does family planning, prenatal care. So there's a lot of investment in federal funds in those types of services, but nothing for abortion care because of the statutory restrictions.
You're about keeping folks in good shape. Okay, thank you very much.
Thank you, Senator Lamb.
Thank you, Madam Chair. Thank you for bringing this bill forward. I appreciate the intent of this bill to really kind of get at a bad federal decision. It was really purely in kind of an anti-abortion provision that the ACA required insurance companies to charge $1 a month rather for each beneficiary. And this money is not really being used to help anyone, as you kind of point out. So I think it's a good way to use this money that patients are already being required to pay for to actually help people in the state. So I was disappointed to see from the letter of the League of Life and Health Insurance, their letter claiming that this bill would be an unconstitutional taking under the Fifth Amendment, that this is money that patients are already required to pay to the federal government because of these requirements. And it's really just going to, it's just additional revenue to these insurance companies. You know, while I know that neither of us are lawyers, you know, does it feel like it's in the spirit of the Fifth Amendment for insurance companies to have to invoke the takings clause in the Constitution to, you know, justify keeping this money within their insurance companies' coffers and not being able to be used to get back to some of these important efforts to protect abortion care in the state?
Want me to take it? Yeah. Thank you for your question, and I really appreciate your thoughtful approach to sort of laying out the issue. So, you know, I first of all want to thank the members of the league for being collaborative with us. They understand that they are holding that money and it's not being used, right? So I will point out that the carriers have been holding on to this surplus fund since 2014. And it's growing and growing. I think it's about $18 million now and about $3 million a year. And it's basically being used, you know, it is being taken from the people who purchase insurance and held. So, you know, they could have been using these surplus funds to further access to abortion care and have not been doing so. For the purposes of sort of understanding that there's precedent for something like this, I think it's important for the committee to know that in 2005, the General Assembly enacted similar legislation. It was sponsored by EHE Chair Paula Hollinger and HGO Chair John Herson, and it transferred the value of the premium tax exemption from our nonprofit carriers to establish the Community Health Resources Commission. So we have done that in the past. If you're not familiar with that, it provides underlying funding for the Maryland Department of Health's kidney disease program under Medicaid and general funding support for the mental health services under the Department of Health and supports the senior prescription drug program. So just wanted to get that on the record. And thank you for your question. I really appreciate it.
Okay, thank you. And last question. I assume you're all right with the Maryland Department of Health has submitted an amendment to shield
Yes.
information about grant applicants from the MPIA.
It's an excellent amendment. I'm glad that they raised that issue because it's very important. Thank
Okay.
you.
All right, thank you.
Thank you. Senator Mounts.
Thank you, Madam Chair. Real very quickly, so I understand the financing, how this works. So how much money it comes from the carriers? It'll be $1 million. Is that?
When you go for it.
So Senator, how it would work is right now, as Senator Kelly said, according to the reports from the Maryland Insurance Administration, from 2014 to 2022, there is a surplus of funds of about $18.9 million. So that reflects that the carriers have taken in that $1 per member per month and minus what they've spent. How the bill mechanically works is 15 months after the end of a plan year, the insurance commissioner plays a very important role in this, would assess how much funding was in surplus in the prior plan year, and then issue an order to move that funding over to the Department of Health. The reason there's a 15-month lag time is clearly the year ends December. Clearly, there could be bills after that. We know providers don't submit necessarily the day of service or the day after service. So it allows some flexibility in getting the accounting straight. And the MIA plays a very important role in ensuring the accuracy of those reports and ensuring they got the dollar amount correct.
Yeah, and that's very detailed. But in essence, so the insurance administrator will do an assessment or an order is probably the proper phrase, based off of the prior year's premiums have been paid. Is that necessarily $1 million every year, or does it vary?
So looking at the prior, since 2014, we estimate that it is about actually $3 million a year.
$3 million.
The bill speaks to $1 million in funding for the first year. That's in recognition that when you start a new program, you're usually not ready July 1. It takes some administrative preparation. So we didn't want to necessarily put so much on the Department of Health, but thought that $1 million was a reasonable amount, and the department has supported the bill.
So the way the bill works is there's $1 million out of the state budget for 1 year to stand up the program, and thereafter the funds all come from the carriers based off of the order from the insurance administrator. Is that accurate?
Almost. The 1 million comes from these special funds from the carriers as well. It's not state general funds.
Oh, okay. So the million to start out comes out of that surplus.
Yes.
And then, so if that money's coming out of the surplus, is that surplus part of the rates that the insured are paying already? How is that going to affect the rest of the insurance market?
That is a great question. The Affordable Care Act sets up a rate setting scenario for abortion care that is absolutely unique. The Affordable Care Act requires carriers to charge at least $1 per month per member, but the actuarial value of abortion care is far less. And we don't actually know what it is because the federal law says $1. It's far less, and that is why carriers, through no fault of their own, have been accruing a surplus.
Thank you. I could go on and on, but you answered my question. I wanted to understand how this is financed. Thank you.
Thank you, Senator. Senator Hedelman, thanks for joining us. Do you have any questions? Thank you. That ends the questions for this panel. Thank you very much.
Thank you.
Next, we have two more favorables, Julia Roche and Melanie Shapiro.
Sure, thank you. Good afternoon, Madam Chair and members of the committee. My name is Julia Roche, and I serve as the Legislative Affairs Director with the Baltimore City Health Department. And as you know, I'm here today representing the Baltimore City Administration to voice our support for Senate Bill 947. This bill will establish a permanent, sustainable fund to ensure access to safe abortion care, comprehensive reproductive health care, clinic security, and other supportive services. After Roe v. Wade was overturned, the Baltimore City Administration demonstrated their commitment to reproductive freedom by allocating $300,000 in general funds to support abortion and family planning services. Since then, the city has awarded 6 unique organizations a total of $285,000 over 2 years. These funds have been incredibly impactful. You heard from our colleague at the Baltimore Abortion Fund that the need has greatly surged. During a period in which their patients tripled in number, nearly 40% of the funding that supported this came from the city. At least 15 municipal governments and 6 state governments have also made such allocations. Maryland must take the next step to establish a permanent, sustainable fund to ensure continued access to care. This is a critical public health issue. A study from the University of Colorado Boulder found that if the U.S. were to ban abortion entirely, the country would see a 24% increase in maternal deaths overall, with a 39% increase among Black women. As you all know, last year, Maryland enacted a package of bills to ensure that we remain a safe haven for people seeking abortions, including those who come from other states. The fund established by this bill is the next step. We respectfully urge you to issue a favorable report on Senate Bill 947. Thank you.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. My name is Melanie Shapiro. I'm the Public Policy Director with the Maryland Network Against Domestic Violence. We are the federally recognized State Domestic Violence Coalition, and we are here in support of Senate Bill 947. Since the Dobbs decision, the calls to the National Domestic Violence Hotline for reproductive coercion have doubled. Reproductive coercion, for those of you that are not familiar, is another power and control tactic used by domestic violence abusers to control their victims. And it can include anything from birth control sabotage to pregnancy pressure, whether it's to force their victim into having an abortion or preventing them from having one. There's a whole range of different tactics that are used by their abusers in the realm of reproductive coercion. What should be noted is that pregnancy is, in fact, the second most dangerous time in an abusive relationship, the first being when a victim tries to leave. And a decision to have a child together is often something that tethers a victim to their abuser forever. IPV is a intimate partner violence, domestic violence is a factor in 64% of all homicides of pregnant and postpartum people, with more than half of all homicides against pregnant and postpartum people occurring in their homes. That is one of the reasons that we're in support of Senate Bill 947. I would also like to add regarding the provision for the insurance. 99% of victims of domestic violence experience financial abuse, so they may not have the resources to access reproductive health care. And if they do have insurance, they cannot use that insurance because the explanation of benefits will go to their home where their abuser is, and that they will see that. So for all of those reasons, this bill is incredibly important to ensuring the safety of individuals seeking reproductive health care, the providers offering it, and we are urging a favorable report on Senate Bill 947.
Thank you, Melanie. Do I have any questions for this panel? I don't see any questions, but I thank you for your testimony. We have one unfavorable. It's Laura Bogley.
Good afternoon, Madam Chair, members of the committee. I'm Laura Bogley, Executive Director of Maryland Right to Life, and we urge your unfavorable report on this bill. We oppose the creation of a dedicated fund to expand the deadly abortion monopoly over women's reproductive health in Maryland. What you heard from the proponents today is a manufactured crisis. They have worked, abortion activists through the legislature have worked to create Maryland as an abortion tourism destination. And now they expect Maryland taxpayers to pay for abortions from women being trafficked in from out of state. This fear mongering with the false premise of pro-life violence has not proven or substantiated with any Maryland specific crime data. In fact, FBI Director Christopher Wray testified before Congress that 70% of the cases of violence or threats of violence has been by pro-abortion activists against pro-life victims since the leak of Dobbs in 2022. In Maryland specifically, we have witnessed a dramatic escalation in violent assaults against pro-life citizens and pregnancy resource centers. I provided you 6 documented crimes just since 2022, and 0 arrests have been made of the pro-abortion assailants. The state of Maryland, by forcing taxpayers to pay endless millions of dollars each year to subsidize abortion businesses, is failing to provide for the legitimate health and support needs of women and families. If abortion was succeeding as a policy, why do we still have an epidemic of unplanned pregnancy? Abortion industry has failed to address those needs for women and families. The real crisis in Maryland is that because of the abortion monopoly in Maryland, the state ranks among the worst states for infant mortality, preterm birth, and has seen a rise in severe maternal morbidity since 2019. This is inexcusable. We need to prioritize funds, and 80% of people polled agree that public funds should be prioritized for programs that support the lives of mothers and babies. We urge your unfavorable report. Thank you.
Thank you, Ms. Bogley. Do I have any questions for this witness? Thank you very much. That ends the hearing on Senate Bill 947. Our next bill is Senate Bill 950. And Senator Hedelman, how convenient. Okay. Carissa Hatfield, Jane Cranky, Lisa Jordan, and Laura Jessic. She was on it. I don't know that was he thought he could speak.
Thank you very much, Madam Chair, Madam Vice Chair, members of the committee, and I will apologize before I begin. I'm going to ask for your indulgence. My subcommittee over in budget and taxation is about to vote out the budget. So I'm going to give my testimony and I will leave it in the great hands of my panelists, if that would be okay. Thank you very much. For the record, my name is Shelley Hedelman, a senator from District 11, and I'm here to present Senate Bill 950. This is a very important bill. It is an important bill to address the needs of sexual assault survivors and the medical care that they can access. If someone is sexually assaulted and decides to report and try to get health care, they can go to a hospital. If they are fortunate, they will go to a hospital that has the professionals, forensic nurse examiners, who are highly trained individuals and healthcare professionals that can conduct a safe exam, a sexual assault forensic exam. If they are unfortunate and happen to go to another hospital, which may be the one that is most convenient and closest to them, they may be told, I'm so sorry, could you go 3 miles away or 30 miles away or even farther to go to a special hospital, a hospital that has the healthcare professionals with that expertise. What this bill does would broaden access to sexual assault survivors who need that health care and make it so that it's not by chance that they're going to the one that has the highly trained individuals that they need. And what it would do do a couple of things. One is it would allow telehealth. It would allow healthcare professionals who are on site in a hospital to use telehealth to get guidance from those forensic nurse examiners who may not be in that particular hospital, but who could connect with them via telehealth and be guided through the exam. So access for sexual assault survivors is a tremendous issue. And while what we want to be doing in this state and what we should be doing is as much as we can to broaden access and to make it easier for sexual assault survivors to report and to get the health care that they need. We have a shortage of FNEs, the forensic nurse examiners, and you will hear about that kind of crisis. And this will help to broaden the access from those experts. It will also ensure that they are reimbursed through the CICB, the Criminal Injuries Compensation Board, just like healthcare professionals in hospitals are now for sexual assault exams. And finally, it will conduct a study. It will enable the Sexual Assault Evidence Kit and Funding Policy Committee, on which we all serve through the Attorney General's office, to look more deeply into other issues that telehealth raises and address them and make some recommendations before, hopefully, the 2025 session. There are some very exciting programs that are happening around the country. You'll hear a little bit about it. You have some testimony in your packet from Penn State, which is conducting this using telehealth in the state of Pennsylvania. And it really is broadening a much needed access for people who need it desperately. So I think it's a win-win for everyone, and I urge a favorable report on Senate Bill 950. Thank you.
Thank you, Madam Sponsor. Do we have any questions for the sponsor since she needs to leave? No questions. You have all favorables in your testimony, so thank you very much.
Thank you.
Good luck with our budget.
Thank you.
Oh, I'm sorry. Senator Lamb does have a question.
Just a really brief question. Glad to see that we can increase utilization for telehealth to solve some of these workforce issues that we're seeing, and really support the bill, but really to help ensure that safe exams can be completed with as little extra impact as possible on survivors. Do we need to do anything special to ensure that these telehealth exams are admissible in court, or is that all dealt with in other parts of the law?
So I think that's a really good question. And I think that's one of the issues in terms of chain of custody, et cetera, that we want to address in this longer term study. In state, I think that there are some hospital systems that might want to go ahead and do this. And so we have clarifying language about that. I'm going to let the lawyers on the panel address that better than I can. Thank you.
Senator. Okay, now I don't see any other questions. Thank you. Lisa, you want to go next?
Thank you, Madam Chair, Madam Vice Chair, members of the committee. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. It is very exciting for me to be in the Finance Committee. Thank you for having me here. The Maryland Coalition Against Sexual Assault is the federally recognized state sexual assault coalition. We are here in strong support of Senate Bill 950. You've already heard Senator Hedelman's excellent description. I do want to add just a couple of things. This is a really long-standing issue. So we have not had strong access to sexual assault forensic exams in Maryland for a very long time. In 2014, then Delegate Kelly had a bill to try to require all emergency rooms to provide the exams. And the best we got was a protocol, which was progress, but still just a protocol. That was 10 years ago. In 2017, we created the Sexual Assault Evidence Kit Policy and Funding Committee that you'll hear about to continue to look at this issue. It is frustrating to me, and I present this testimony to you because we had a woman call us the other day who went to 3 different hospitals, 3, to get the exam. I have to tell you, I would not do it. And I really wonder how many survivors are going to a hospital, asking for an exam, being told that they don't have someone there, that they can't get the exam, and going home and taking a shower. This is no way for us to treat survivors. This is peer-to-peer telehealth. And so, Senator Lamb, I believe the answer to your question about the admission in court, and I can say this as a lawyer myself, is that the training for the forensic nurse examiners includes detailed training about all of that, and that law enforcement goes to the hospital to pick up the kits. And so that's part of the reason that we want to make sure that we've got forensic nurses working with the non-forensic nurses. But we have to have this law, otherwise we won't be able to provide the peer-to-peer telehealth because of regulations. For those reasons, the Maryland Coalition Against Sexual Assault asked for a favorable report on Senate Bill 950.
Thank you. Who'd like to go next?
I can go ahead. Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Carissa Hatfield. I am an Assistant Attorney General and counsel to the Sexual Assault Evidence Kit Policy and Funding Committee. I know that's a mouthful. We can go ahead and address it as the state committee going forward. We reached this conclusion that telehealth was necessary in Maryland for forensic exams through actually a report we were assigned to do for self-administered sexual assault evidence kits. And we at that time were seeking alternatives to those exams. And we started to hear from folks about telehealth programs across the country. That committee met with the Penn State program, which, as Senator Heddleman mentioned, we do have some literature from that program that has been submitted. We also spoke to a program through the International Association of Forensic Nursing. Through talking to these programs, it became very clear that this is the next step of progress in Maryland for survivors of sexual assault. Peer-to-peer telehealth allows a trained forensic nurse examiner to work with another medical professional to bring services to a survivor who is not in the same location. These programs consistently provide services that see positive results, both in patient satisfaction and in nurse retention rate. Nationally, we do see a significant turnover rate for forensic nurses, and these programs see significantly fewer nurses turning over. While it's clear to us that this program is the future for Maryland, we just have not had the opportunity to look at this program and see how it would work here, how it would be funded, who would house that program, and what regulatory and statutory changes would need to be made in order for it to move forward. And that is why we are asking for the opportunity to conduct this study and be able to provide recommendations to the legislature for the 2025 session. We also acknowledge, as Lisa said, that programs may want to move forward now, and this language allows those programs to do that. And for these reasons, we would urge a favorable report on SB 9.
Thank you. And finally, we have Laura.
Yes, good afternoon, Madam Chair and members of the committee. I'm Laura Jessic, the Sexual Assault Kit Initiative and Response Team Program Manager with the Maryland Coalition Against Sexual Assault. I'm here at the invitation of our director, Lisa Jordan. As you just heard from her, MCASA is the coalition of the rape crisis centers across the state of Maryland, and our office includes the Sexual Assault Legal Institute, where we provide direct representation to survivors of sexual assault in Maryland. We are here in support of Senate Bill 950. Sexual assault forensic exams offer survivors critical free medical care and forensic evidence collection after an assault. This care is not dependent on reporting to the police and is important for both forensic evidence collection and preservation and in ensuring the physical well-being of the patient. There are 22 hospitals in Maryland that offer safes, and these programs may not be able to serve all survivors, or they may not have 24/7 services available. So what happens when a survivor reports to the wrong hospital? They're turned away. When I was assaulted as a teenager in Pennsylvania, my local hospital turned me away and told me to seek care elsewhere. To this day, I will never forget how devastating this was, how it made me doubt everything that happened to me and made me feel like I didn't matter to the system. MCASA frequently hears stories like mine from Maryland survivors about their barriers to obtaining care and struggles locating the right hospital. The exploration and eventual implementation of a telesafe program will make a world of difference to survivors. The passage of Senate Bill 950 will show survivors that medical forensic care is a priority for the state, that the pain and confusion of survivors who have been turned away has been heard, and Maryland is not going to ignore the challenges of survivors face any longer. For these reasons, MCASA requests a favorable report on Senate Bill 950. Thank you.
Thank you for your testimony. Do I have any questions for this panel? I see no further questions. Thank you.
Thank you.
I called Jane Cranky up from the Hospital Association. She didn't come. Is Jake Whitaker here?
Madam Chair, if I may, Jane had to run across the street and she sent her apologies.
So the house is more important.
She's got a long text with deep regret. I know it's heartfelt.
Thank you. Thank you, Lisa. They do have a letter of support. Next, I see that Senator Hester's here. This is how we end up jumping out of order. So Senator Hester, Senate Bill 834. Thank you for joining us. You have a panel, I believe.
Got a couple.
Let me double check. Karen Morgan, Joseph Kerrigan, and Steve Sakamoto Wengel. You don't have a panel? Are we missing
So
people?
we do, but this is not Steve.
No,
That's,
Joe.
this is Joe.
This is Joe. Karen's not here.
And Steve there. Okay, great.
Okay, thank you.
Thank you very much, Madam Chair, Madam Vice Chair, members of the Finance Committee. For the record, Senator Katie Fry Hester, here to talk with you about Senate Bill 834, which establishes a pilot program to safeguard Maryland residents by raising public awareness of the pervasive and potential threat of online SMS and telephone-based scams. I want to share with you a couple of examples. Hopefully none of this has happened to any of you. These scams are getting more and more sophisticated and also more prevalent. Earlier this year, the largest example of a successful SMS scam caused a Kansas bank to fail. What started as seemingly an innocuous text to Heartland Tri-State Bank's CEO, Sean Haynes, culminated in the transfer of over $50 million into a fraudulent holding account. This scam was coordinated over several months which caused the bank to go under. This type of scam is called pig butchering because it's designed to bleed victims dry. Scams are not happening to people who are careless and lack online cyber personal awareness. So scams can be sophisticated, highly effective, targeted, and increasingly common. Now, we've done some research here in the state of Maryland, and it seems that scams, particularly those conducted online and via telephone channels, pose a significant threat to our residents, jeopardizing their financial stability and sense of security. In a study that you'll hear of shortly by the Johns Hopkins Information Security Institute, 549 participants disclosed that they had collectively lost $436,000 over the previous several years as a result of online scams. Now, if we extrapolate this to the sample size to the rest of Maryland, there's an estimated $3.8 billion of losses over the past couple of years. And from what we do know is that this is likely underrepresented because it's self-reported. And if we were to translate this into the taxes that it costs the state, we could be losing somewhere between $5 to $8 million a year in taxes. Just a few more examples. The pig butchering scam, like I mentioned, that brought down the Heartland Tri-State Bank, those account for $429 million of losses nationally. Online romance scams cost $3.3 billion a year. The prevalence and success of phishing has grown as artificial intelligence technology has become more sophisticated. And while internet crime victims have not massively increased over the past years, the amount of money that they have been swindled has. This suggests that the fraudsters are working smarter, not harder, and selecting their targets more carefully and stealing about twice as much with each successful attempt. So colleagues, to address this troubling rise in scams, the Communications Subcommittee of the Maryland Cybersecurity Council has recommended a simple solution, the creation of a scam awareness program. This bill establishes a 2-year pilot for this program housed in the Office of the Consumer Protection Division of the Office of the Attorney General. The scam awareness program pilot will focus on increasing public awareness of common threats and scams. The program has 3 simple objectives. First, identify the most common types of email, SMS, and telephone scamming methods used in the state of Maryland. Second, develop consumer safety messages to help individuals identify these common scams and mitigate associate risks. And third, to disseminate these safety messages through relevant communication channels to reach a wide audience. Now, to ensure the success of this pilot program, we know the Office of the Attorney General can't do it alone. And so Senate Bill 834 encourages partnerships between the Consumer Protection Division and the academic, nonprofit, and business sectors. These stakeholders will provide valuable input to inform the development of messaging and outreach through their individual networks, therefore amplifying the state's investment. This bill is urgently needed to combat escalating threat of financial loss, and the pilot program will equip vulnerable individuals with the knowledge to recognize and withstand scams. By supporting this bill, you both demonstrate a commitment to protecting Maryland residents, and you contribute to the resiliency of our community, and we learn to navigate an increasingly complex digital landscape. For these reasons, I request a favorable report on Senate Bill 834.
Thank you. Joe, would you like to go next?
Sure.
My name is Joe Kerrigan. I'm a senior security engineer with the Johns Hopkins University Information Security Institute. Recently, as Senator Hester alluded to, the Maryland Cybersecurity Council, Johns Hopkins University Information Security Institute, and the National Cryptologic Foundation collaborated to conduct this survey of Maryland residents. When we got the results back, the most shocking thing to me was that 25% of the respondents said they had been scammed out of some amount of money. We asked them how much money they had been scammed out. Can you quantify it? And while the largest group of people said they lost under $100, there were people saying that they had lost into thousands, tens of thousands, and even 2 respondents that said they lost $100,000. These losses may seem like outliers, but there is no shortage of cases where people have lost over $100,000. In fact, last month, Mallory Sofaste from WMAR had a story that was about 7 people that contained a statistic, 7 people from Maryland lost over $3.8 million in a particular scam that was happening. It's over $500,000 per person in this scam. These statistics came from the FBI's Internet Crimes Complaint Center. That's a devastating loss for these people. So smaller losses happen more frequently, but when the larger losses happen, it's life-changing. These scams are very elaborate. They play on people's emotions. They also play on their ignorance of banking systems and law enforcement systems. Senate Bill 0834 will be a good first step in filling that knowledge gap that leads to these kind of losses. Informing people of the tactics used in these and other scams will protect people by allowing them to identify a scam when it's beginning and notice the red flags is happening. An awareness program could educate the public and help them recognize these red flags. I ask for a favorable report from the committee.
Thank you. And finally, Steve.
Good afternoon, Madam Chair, Madam Vice Chair, members of the Finance Committee. Steve Sakamoto Wango with the Consumer Protection Division, the Attorney General's Office, here in support of Senate Bill 834. I think the problem has been well documented of Maryland citizens, particularly senior citizens, falling victim to scams. I know that this ties in well with Senator Kramer's gift card bill, which is one of the means that the scammers use to collect their money from the victims. While our office, conducts education and we go out and give talks to senior centers, as does the Office on Aging, as does AARP, as does other organizations, clearly, too many Marylanders are still falling victims to scams. I know that the fiscal note for this is very large, but if we want to be able to put together and conduct and disseminate an effective education program to help prevent Marylanders from becoming scam victims in the first place, basically it's going to take money, and that's based on consultation with other agencies that have conducted education programs. It's based on our own history with conducting education programs. And so unfortunately, to be able to do something effectively, it will take a fair amount of money to be able to put that together and disseminate it to the people it needs to reach. But we do believe this is an important issue. We receive a lot of complaints from scam victims, as well as people who recognize scams, fortunately, before they become victim and want to report them to our office. So we urge a favorable report on Senate Bill 834. Thank you.
Thank you. Do I have any committee questions? I don't see any lights. I do have a question, Steve. Are we doing any kind of outreach to try to educate? I mean, a lot of this is elderly people. We just had someone in my community, she wired $66,000. This fraudster took a long time with her to become friends on the, on the phone. So, but are we doing anything to help our seniors who seem to be the ones that are more likely taken in by this?
Yes, Madam Chair, as I mentioned, we have education programs. We do outreach. We do send speakers out to senior centers. We also work in conjunction with the Office on Aging and AARP to try to reach people. So we do undertake efforts now, but clearly more can and needs to be done.
Thank you. Thank you for your work. I don't see any other questions. That ends this panel and it ends the bill hearing. Thank you, Senator.
Thank you.
Next. Pardon me? Oh, Karen, I called you twice, but you can,
I'm sorry, I was,
I'm sorry.
I did not hear that and I was right outside, so apologies, Madam
Well,
Chairman.
I'm sorry about that, but you can go ahead and testify.
Okay, great. Thank you so much. And just for the record, my name is Karen Morgan. I'm a member of the Executive Council with AARP Maryland. Our office supports Senate Bill 834. We think this is necessary. In answer to your question, Senator Bidel, you asked about outreach, and AARP Maryland is very focused on outreach as one of the lead volunteers for fraud prevention. I've been all over the state talking to different senior citizens groups or other types of groups about things that they can do for fraud prevention. We were active during the COVID epidemic with virtual presentations. And now, you know, I will go anywhere that I need to talk to people about the things that they can do to prevent fraud. Because this is a war that we're in. Make no mistake about it. I'm not being overly dramatic. It is a war. And these people will do anything to strike at the very heart of our financial survival. And we have to do things. We have to take positive steps. This bill is a positive step. Yes, it has $1 million fiscal note, but in 2023, Marylanders lost over $164 million from frauds and scams, 164 million. So $1 million to get the conversation started on positive steps that people can do to prevent this scourge from attacking their lives is well worth the investment as far as we're concerned. And that's why we urge a favorable report on Senate Bill 834.
Thank you. Thanks for your testimony. Do you have any questions for Karen? Thank you. And now that does end the hearing for Senate Bill 834. Next we have Senator Klausmeyer, Senate Bill 998. Certainly can bring your panel up. I'll call them Elise Hicks, Claudia Flores, Molly Jones, and Ben LaRocco. Looks like everybody's here. Thank you.
Good afternoon, Madam Chair and fellow members of the great Senate Finance Committee, for the opportunity to present Senate Bill 998. This legislation will set up a framework to regulate earned wage access services in Maryland. And I might begin before I start all of my testimony, and just say that at the onset of this bill, I guess that was probably back in November, that I met with some folks, and the bill sounded really, really, I thought it was really good. And since then, I think there's a lot of misinformation that has been going around, and people would kind of yell at me and say, you can't be putting this bill in. It's terrible. And why? Well, that's what I would always get. Nobody would express why they didn't like the bill. So as I said, I think there's a lot of misinformation, and I'm at the point of, if anybody wants to work on it, we can get it and get rid of the misinformation and do it right and take it from there. But anyway, the industry of earned wage access services was only brought to my attention over the past year. In essence, it is a product to help workers access wages that they have already earned before payday. In the past, if an employee wanted an advance on their wages to cover an unforeseen expense, they could simply ask the employer for the funds and have that amount reduced from their next paycheck. Modern payroll systems don't allow this flexibility. So this new product has filled the gap to help workers access their earned wages when they need it. Senate Bill 998 would set up a framework to ensure that any company that offers this product is properly regulated. The bill requires providers of earned wage access services to register with the state and sets up several requirements to protect consumers. I want to highlight that the bill requires workers to be offered at least one no-cost option to access their earned wages, and also set up many notifications and transparency requirements to ensure that consumers are informed at all steps. There are several different models of this product that are already offered, and this legislation tries to take all of those models into account to create a fair framework that protects workers while still ensuring that good actors in the space can continue to operate. I am joined on my sponsor panel by representatives from several of the different companies that offer this product, who can explain in more detail how this works in practice. And that was what I found really interesting. I met with one person and I said, oh, that's great. And then before I knew it, there were 3 or 4 other different companies that are doing this. So I understand that the Department of Labor is also offering their own legislation to regulate this new and growing industry. While I appreciate their attention and work on this issue, I feel that Senate Bill 998 is a framework that better addresses the realities of the industry and need for workers to be able to assess the capital. Thank you, and I look forward to the discussion on this important piece of legislation. And I think that's about it. And I will pass it on.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the Senate Finance Committee. My name is Elise Hicks, and I'm from Daily Pay, and I'm testifying in support of SB 998. We're the country's largest employer integrated on-demand pay provider in Maryland. And we've partnered with 527 in-state businesses to provide over 67,000 of their employees our service. As this committee knows, 2/3 of Americans live paycheck to paycheck, which can result in missed or late payments, causing consumer credit scores to drop and leading to penalty fees, higher financing costs, and difficulty qualifying for future credit. Most Americans lack the necessary savings to cover emergency expenses between paychecks. And even those making $100,000 per year are now experiencing financial fragility. Earned wage access provides a short-term liquidity solution to the infrequency of payment issue brought about by the traditional biweekly pay schedule. It is popular among Maryland workers today because it gives an alternative to a $35 bank overdraft fee or a $30 credit card late fee and other high-cost credit products. While each EWA company differs slightly, we share a few key characteristics. First, all EWA is based on wages earned. Workers can only access the money they have already worked for, and we are not providing credit. 2, all EWA products are non-recourse. There is no requirement to repay, no collection activity, and no credit bureau reporting for non-payment. 3, at least one no-cost option is offered by most EWA providers, such as through a debit card or next business day ACH bank transfer. However, a small flat fee of about $3 for instant delivery to any bank account is common and similar to an out-of-network ATM fee. Daily Pay appreciates this bill's thoughtfulness in acknowledging that EWA is a separate and distinct financial product deserving its own regulatory oversight and licensing program. And with that, I'm happy to take any questions that you may have.
Thank you. Who's next?
Chair Beidle.
Hold that. Just,
okay.
it'll come.
It makes me nervous.
Be comfortable. Thank you.
Madam Chair, Madam Vice Chair, honorable members of the committee, it's nice to see many of you again. For the record, my name is Molly Jones, and I'm the head of public policy at PayActive, which is an employer integrated EWA provider that has been operating in Maryland for over 10 years without any complaints. We are proud to partner with over 300 leading Maryland employers, and thousands of Maryland workers have access to our service if they need it. PayActive uses verified time and attendance, payroll, and census file data to make up to 50% of an employee's wages available to access if they need it. This is a valuable financial security tool for thousands of Marylanders to cover unexpected expenses, and it is a responsible and safe alternative to costly online payday loans, credit card debt, and bank account overdraft. We appreciate the effort and the innovative approach of this committee to create a regulatory system that is aligned with how EWA operates rather than shoehorning it into an ill-fitting regulatory system. The licensing bill before you today creates several important consumer protections. First, it ensures that EWA remains non-recourse and users can cancel at any time. Second, that there's no impact on a user's credit score, and there will never be any credit checks to participate. So even underbanked or low credit workers will always have access to this service. It creates a number of important fee protections, including ensuring there's never any interest, origination fees, late fees, or penalties of any kind. It requires that EWA providers offer at least one free option for users, and it mandates clear, straightforward, transparent fee disclosures. It's important to align this EWA regulation with how the product operates, or we would be at risk of having providers leave the state. This was the case in Connecticut, where the banking regulator moved to regulate EWAs alone, and several providers have left the state, and thousands of Connecticut workers have lost access to this product. We respectfully request a favorable report. Thank you.
Thank you.
Good afternoon, Chairwoman Vital, members of the Finance Committee. My name is Ben LaRocco. I'm the Senior Director of Government Relations for EarnIn, one of the largest earned wage access providers in the country. Speaking in support of Senate Bill 998, this bill was negotiated based on a national framework, Maryland specific, that's been in the works for several years with input from dozens of legislators, regulators, attorneys general, and consumer advocacy groups. It provides a strong framework to allow regulatory oversight and safe access for consumers. In Maryland, more than 75,000 residents have used our product, including more than 31,000 last year. Top employers of our customers include Johns Hopkins Medical, Baltimore County Public Schools, Baltimore City Public Schools, and Prince George's County Public Schools. People are smart. They know how to manage their own money and choose the products that are best for them. Hardworking families across the state are voting with their pocketbooks to choose EarnIn and earned wage access because it's safe and effective. The current business model empowers consumers because all fees are voluntary and customers can reschedule or postpone their need to repay with no penalty if life happens and they can't. There are never any mandatory fees, credit checks, late fees, interest, or credit reporting under the current framework. Last year, Connecticut advanced a similar framework to the OFR proposal in HB 246. This framework effectively bans the current EWA business model and forced us to leave the state of Connecticut. Our customers were left with nothing on short notice and overwhelmingly worse off both financially and emotionally. Our customers saw 10% more overdrafts than a similar group of customers next door in Massachusetts, thousands of dollars of fees that should have been avoided. We did a poll of our customers asking them how they were faring. 74% of the respondents said they reported additional stress about their finances. 67% reported cutting back on things they enjoy. 60% felt helpless, and sadness, panic, and outrage were emotions that large percentage of customers felt after losing access to our service. Please vote for Senate Bill 998. Thank you.
Thank you. So I have some questions. Senator Reedy.
Thank you, Madam Chair. Maybe Claudia or yes, probably any of you guys could maybe answer this question, but it's been an interesting discussion about this that I've been reading up before the hearing. So the difference, payday loans are immediately what people think of when they think of people having money before they get their paycheck. And you guys provide, I think all of you provide an alternative to that, which I think a lot of us agree can become very predatory and is problematic. Can you just talk about what people have to pay to use the service? Ben and I have met before, so I know a little bit about it, but I just wanted to see if it's sort of uniformity. What are they, for any of you, we should have one person answer, but if one of you could answer, what do they pay to use the service that you guys provide?
Yeah, thank you for the question. It's a great question. We have 5 free options and 1 paid option for users to access their earned wages. The free options are you can do an instant transfer to our debit card. If you have direct deposit set up on that card, that transfers instantly and is free. We have a next day ACH bank transfer that is free. We have a bill pay feature integrated into our app that is free. You can take an Uber ride if you need to get to work for free. And you can load to an Amazon account for free. Those are all free. There's one paid option. So for a flat fee of $349, if you don't want to set up direct deposit on our card, you can pay $349 to have those wages transferred instantly to any bank account.
Can a person take out more than what they've got coming to them in the next paycheck?
No, we use verified time and attendance payroll data, and we only allow them to access up to 50% of those earned wages.
And what happens if they don't want to pay you back?
They can cancel the payment.
So
They
there's
can-
nobody dinging their account or giving them a
That's right. There are
lien?
no credit checks, no underwriting, no recourse of any kind.
Okay, all right. Thank you very much.
Yep.
Thank you for those questions. Senator Kyle.
Yeah, thank you, Madam Chair. Appreciate this bill. I really do like the product. But I'm speaking, I think with Claudia, when you and I spoke, you may want to move the microphone over there if you wouldn't mind answering. One thing that I really thought was interesting about these products is that the data that you have as far as usage, because I think there's some concern that like if people are using these, like relying upon these regularly, and I guess it's their money, so if they want to have access, but I do like that, if something comes up and they have to get their brakes fixed or something like that, some unexpected expense, that they have access to these funds that they are going to be getting anyway. But it's not something where people are continuously relying upon these services. So I don't know if maybe you could speak a little bit or to that, or whoever.
Yeah, so Claudia and I work for the same company, Daily Pay.
Mhm.
And I think your question goes to the usage or potential high frequency
Right.
of use of this product. So Daily Pay has done some research, and that's not the experience of our users. We see that 1% of our users are high frequency, and after about 4 weeks of using Daily Pay, that frequency goes, it dissipates. So about 4 weeks in, you see 50% less of usage. 8 weeks in, we have seen about 80% less dependency on the usage of our product, and between 8 and 12 weeks, 97% have, dissipated their use of our product. We also see that after the first use, people usually take a break in between a month and a year from using the product.
It's interesting. Thank you. Thank you, Madam Chair.
Senator Mount.
Well, thanks, Madam Chair. Approximately how many people in Maryland are using your service right now?
So we had over 30,000 use it last year. There's probably 20 companies in the market total, so hard to say exactly, but probably a couple 100,000 total across the state.
And are there any complaints with the service?
To the best of our knowledge, there has not been any complaints to the Attorney General's office or to the Office of Financial Regulation.
Thanks.
I don't see any other questions for this panel. Thank you very much for your testimony. We have another panel of favorables. Roger Mano, Frank Boston, Ian Maloney, Phil Cronin, and Aiden Hazikas. I want you to start from the left, sitting down, and the first person in the first seat, it's my left, your right. The first person's going to start, and we're just going to go right down the line.
Her left. All right, your left.
All right. Thank you, Madam Chair, Madam Vice Chair, and members of the Senate Committee on Finance for providing me the opportunity to testify before you in support of Senate Bill 998. My name is Ian Maloney. I'm the Senior Vice President, Head of Policy and Regulatory Affairs at the American FinTech Council. Our mission at AFC is to promote an innovative, transparent, inclusive, and consumer-centric financial system by supporting responsible innovation in financial technology and encouraging sound public policy. AFC members are at the forefront of fostering competition in consumer finance and pioneering ways to better serve underserved communities. We proudly represent the largest earned wage access companies who are currently serving thousands of Marylanders and millions of consumers and families across the nation. Importantly, all the individuals that were on the previous panel are members of AFC. As part of AFC's efforts to ensure EWA providers effectively serve consumers, we established clear standards on what constitutes responsible EWA. Specifically, these standards require a voluntary no-cost option be made available to all users, strong fee disclosures represented in a clear and transparent manner, and the ability for users to cancel EWA services at any time. The revisions of SB 998 closely reflect the standards we established for responsible EWA providers. Establishing the regulatory framework enumerated in SB 998 will allow EWA services to flourish in Maryland and help workers access the pay they are entitled to instantly by giving EWA providers a clear and functional regulatory path that recognizes the nuances of the service and allows providers to offer their services most effectively. In turn, consumers will be able to engage with responsible EWA providers in a manner that fits their lifestyle best, whether the services are offered through an employer, standalone product, or as part of a subscription. In closing, I applaud the Maryland legislature for taking up this issue in a timely manner and seeking a pragmatic solution, and I urge a favorable report.
Thank you. Roger?
Well, thank you, Madam Chair, Madam Vice Chair, members of the committee. Attorney Roger Mano on behalf of Pay Active and EWA, Earned Wage Access Provider. We appreciate the opportunity to testify and the ongoing dialogue that we've had with this committee and with the Office of Financial Regulations over the last, I would say, 7 months. We approached the legislature in August, about 7 months ago, proactively in pursuit of legislation to begin to regulate the EWA industry, which has for about 10 years operated without any specific regulations, although there has never been, contrary to what you may have heard, a single instance of a violation or a complaint either to OFR or to the FTC. We can provide data on that if that's useful to you. This bill helps to maintain a safe space for Maryland workers and consumers. We believe it's a responsible approach to begin to regulate this industry. We think that you should put some guardrails in place, quite frankly, and that EWA providers should register with the Office of Financial Regulations, that there should be a whole host of consumer protections that we offer right now, that those services be non-recourse, that the company can't go after a worker, that there are no overdraft fees, compounding interest, credit checks, credit reporting, or any other predatory or deceptive practices like are the case in the payday lending industry and not in the earned wage access industry. We think that this bill strikes the right approach. There is another bill. Respectfully, we think that this bill has a greater panoply of consumer protections. That should be our objective. So the committee has some work to do. We look forward to working with you and to assist in the work that you have to do in any way that we can. We ask for a favorable report. Thank you.
Good afternoon, Madam Chair and members of the committee. I'm Frank Boston. I'm here today on behalf of Aaron, and we ask this committee to vote this bill favorably. I want to say special thank you to Senator Klausmeyer for introducing the bill on our behalf. The main issue here is that this product is not a traditional loan. It is an advance on money that you have already earned. There are no terms, there's no interest rate, there's no interest at all. There's no recourse if the consumer does not pay, and we do not report to credit agencies. This is a new and innovative product that thousands of Marylanders use. There's an old saying, if it doesn't look like a duck, it doesn't quack like a duck, then it ain't a duck. This is not a loan. It's an advance. You should know that businesses such as Home Depot, Walmart, Amazon use this product. Their employees all use this product. School systems and teachers also use this product. Baltimore County, Baltimore City, Prince George's County, Montgomery County, just to name a few, their employees use this product. Medical systems use this product. The Johns Hopkins University has employees who use this product. As you can see, this product is very popular in the state, and we request a favorable vote from this committee. Thank you, Madam Chair.
Good afternoon, Madam Chair and members of the Finance Committee. Thank you for having me today. My name is Aiden Scass, and I'm here on behalf of the Chamber of Progress. Make sure you can hear me. I'm here on behalf of Chamber of Progress, a tech industry coalition promoting technology's progressive future. And I'm here to urge you to support and be favorable towards SB 998, which will regulate earned wage access services. The earned wage access industry has several business models. One is employer integrated, which generally allows employees to receive their paychecks earlier from their employer. Another model is direct to consumer, where a third-party service provider provides funds to the consumer without direct involvement from the employer. In both models, an EWA provider allows users to access anywhere between 50 to 100% of their earned wages at any given time. We are strong supporters of providing consumers with better alternatives to predatory lending and junk fees at banks. Earned wage access services help workers bridge the gap from today to payday and frees workers from depending on the payroll cycle and financial system that frequently disadvantages them. Based on a survey conducted by 3 direct-to-consumer EWA service providers, an overwhelming number of EWA consumers said they understood how the service structure works and consider it the best option to manage their spending. EWA provides consumers the opportunity to stretch their dollar further than the standard 2-week pay cycle. The cost of living in Maryland is 16% higher than the national average, and when it comes to basic necessities such as food and clothing, groceries are around 6% higher than in the rest of the country. In this post-COVID inflationary economy, the usage of EWA has increased across the board. From 2018 until now, these services tripled in usage in response to consumers adapting to a financial environment where they are empowered to spend without lack of liquidity. Thank you for your leadership in promoting responsible policymaking for earned wage access with SB 998. This bill will help ensure that Maryland consumers, businesses, and the broader economy will thrive in the emerging fintech economy.
Thank you, Madam Chair, Madam Vice Chair, members of the Senate Finance Committee. My name is Phil Cronin. I'm with Chime Financial here today to support Senate Bill 998. Chime is a financial technology company, and we were founded on the premise that basic banking services should be helpful, they should be easy to use, and they should be free. In Maryland, we serve approximately 125,000 of our members, and we lead the market in free fee banking services. So checking and savings accounts fee-free, faster access to direct deposits. You can overdraft your accounts with no fees with Chime. And we also offer a secured credit card, which helps people build their credit history. The overarching policy issue has been touched on a couple of times today, but 65% or more of Americans, around that number, have low cash balances, which are being exacerbated by lengthy pay periods. So Chime is exploring ways right now to bring to market an accessible, low-cost earned wage access product that can expand liquidity for our members. So we support this bill because we think it strikes the right balance between recognizing the utility and unique nature of earned wage access while codifying important consumer protections. And notably, this bill would mandate standards for earned wage access, which clearly distinguish the product from traditional credit and loan products. Those have been touched on today, but I want to emphasize no underwriting or assessment of an individual's credit worthiness in order to qualify, no recourse against the consumer, including no penalty for failure to pay outstanding balances, no late fees, no interest, no reporting to credit bureaus, and no referral to debt collectors. And then finally, offering at least one no-cost option to the consumer. Passage of this bill will establish an appropriately tailored earned wage access law for Maryland that creates a clear pathway for scalable, consumer-friendly EWA products for all Marylanders, and therefore we respectfully request a favorable report from the committee. Thank you for your time.
Thank you. Senator Kramer, you have questions?
Thank you, Madam Chair, and thank you all for your testimony. The one thing that caught my attention, and to the nice woman from the Chamber of Progress, my recollection is that your organization has had significant opposition to efforts to protect children from being spied on by big tech industry and tracking them and gathering their data. And you're coming in support of this bill. So I very much appreciate the testimony that I've heard. And sounds like there may be something meritorious to what you're doing. But by virtue of your company's support of this bill, a red flag popped up for me because it's the same organization that has been very much fighting efforts to protect children from big tech. So just wanted to share with you, that's a little bit of a red flag, hearing you come to the table in support of this bill. Thank you, Madam Chair.
Thank you, Senator. I have some real specific questions. If none of the other committee members have questions. So Phil from Chime, you said you have 125,000 people participating in your program in Maryland, correct?
Just to clarify, Chime does not currently have an earned wage access product. We are testing one out right now and wish to bring it to market, hence our support of this bill, which we think would create a regulatory environment.
What was the 125,000?
We have 125,000 members currently who do their banking with Chime. So we're not a bank, we're a fintech that works with 2 brick and mortar FDIC insured banks. And we have 125,000 members currently in Maryland who could potentially take advantage of this product if we brought it to market.
I guess I want, somebody else said they had 30,000 transactions last year in Maryland. Who said that?
That was my client, Ben LaRocco, who said we last year in 2023, we had 30,000, and I think the total number so far in Maryland is 75,000.
So why do we need a bill if you're already doing this in Maryland?
I think the issue, and help me out, Roger. I think the issue arose when the Office of Financial Regulations put out an advisory opinion back in August and September with some questions on, you know, the way some of the products operated and on some of their provisions, which prompted us to say, hey, we're doing fine. We have no problems. There's not one complaint. Can we sit down and talk to you about it? And we reached out to try to set up, at least my company reached out to try to set up some meetings. I think we had one initial meeting, but then we wanted to follow up to talk about common sense legislation for licensing and, if needed, regulation, because it is a product. It is here to stay. People like it. And we wanted to work with the department in that regard, but we never heard back.
Okay, so confirm that there's no interest charge. I heard people say that, but as I'm reading the testimony, there are companies that charge interest.
PayActive doesn't have interest, Madam Chair. And I'll echo what Frank just mentioned about the genesis of this thing. The OFR issued a guidance back in August. It was very difficult to understand where the guidance was going. There were a lot of questions that were raised. I sat down with PayActive, Frank sat down with his client, several of us tried to figure out sort of where this was going in an industry that had been operating without any issues for 10 years in the state of Maryland. And just like several other states have done recently to begin to regulate this industry, we set out on a path to do the same thing. We met with members of the committee and with you, Madam Chair, and that is the genesis. I will say, you know, respectfully, that we were asked at the time of that meeting, this is early September, late August, to submit questions to help to clarify what the guidance did. And we had quite a few questions, and there was a law firm involved. We never received a response. So we asked.
My last question is,
yes,
there's a lot of comments in the testimony about tips, about, you know, this encouraging people to leave tips. Is that something that PayActive does?
It's something that, just to finish up on your other question, that 75,000 on the total was just one company. There's at least 10 other companies in this space. Okay. And it's previously testified at least 250,000 people have used this product in the state of Maryland.
Okay. Are they all charging tips, or are they all requesting
tips?
Tips?
On tips, I can't speak for the others, but Earn-In is a company that allows for you to offer a tip. It's not mandatory. It's you know, it's akin to you know, DoorDash, or when you go to a restaurant, anywhere that has a tip.
This isn't the same. So
yeah,
the tip thing bothers me.
Yeah, and it's optional. You know,
I understand it's optional, but it will, so many of the people that use this product are going to be on the lower side of the economic scale.
right,
And we don't want to do anything that causes them to spend more money than they absolutely need to spend. So I
right.
understand there's a fee, but the tip thing is bothersome.
And sometimes it's not always a fee. There's a fee if if you need it right away. Just like if you, so I have Cash App. If you need the money right away, then there's a
Right.
fee. And we don't even get all of the fee because the ACH company gets a lot of it.
Okay.
Or if you wait 2 days, then there's no fee at all. The tip provision is, if there is no fee and, it's totally a free product to you. And if you want to leave a tip, you can. Some people do, some people don't.
Okay. Do I have any other questions from the committee for this panel? Just me with a lot of questions. Thank you. Thank
That
you
was
for
good.
answering.
Thank you, Madam Chair.
Thank you.
Members.
Thank you.
Okay, so our next panel are the unfavorables. Wilson Meeks, Antonio Salazar, Amy Hennon, Tammy Bresnahan, and Monica Burks. The secretary can't be here. She's testifying in the House. We lost another witness to the House. These are the opponents, yeah. And Mr. Salazar is the Commissioner of Financial Regulation. So you're gonna,
Do you have to see?
Tony, you're gonna go first. You're sitting in the hot seat. And then we're gonna go right down the row, okay?
All right. Thank you, Chair Vital. I'm here, as you mentioned, for Secretary Wu. Expresses her regret for not being here. She's at ECM. But yep, thank you. Good afternoon. Members of the committee, appreciate the opportunity to testify on Senate Bill 988. The Department of Labor is charged with protecting workers' hard-earned wages and as well as enforcing consumer finance protections. If Secretary Wu was here, she would tell you that because of both of those mandates, the department respectfully opposes this legislation. Now, the department's not saying that there is no role for these type of short-term loan products in Maryland, but what we do believe is that these products should be regulated in a manner that's consistent with the way Maryland has historically approached consumer protection regulation. So the department has proposed legislation, which was alluded to, and that's in the House, to address just that need in a manner that's consistent with our current framework. 988, by contrast, creates a new separate regime for earned wage access products that risks opening potential for harm to consumers. So that's why we want to continue along the path that the legislature has already done. These products are aimed at folks who are living paycheck to paycheck, but yet they cost them for fees and tips. So, the companies themselves have the ability to earn money on these, and they do that through the tips by loaning out the money constantly. So unlike a regular lender that loans money once, they loan it out week after week after week, whatever. So technology is very powerful, and we obviously want innovations to create more access to financial tools, but we know that we can't let tech products run free with only limited safeguards. So I'm concerned that this legislation placing no restrictions on the products, on the fees that can be charged, or on existing consumer protections gives the companies free range. And so with that, we respectfully request an unfavorable report on 988.
Good afternoon, Chair Beidle, Vice Chair Klossmeyer, and distinguished members of the committee. For the record, I'm Amy Hennon, the Legislative Director for the Office of Financial Regulation, and I want to follow up on Commissioner Salazar's testimony and respectfully request an unfavorable report on SB 998. We want the committee to understand that OFR is not opposed to earned wage access products that are the subject of this bill, and appreciate Senator Klossmeyer's efforts to move the debate on this topic forward through the introduction of this bill. However, OFR already has an EWA bill pending in the House, which is HB 246, which is a bill that codifies the principles that OFR believes currently apply to EWA products. Realistically, we believe that OFR, the sponsor, consumer advocates, and industry all want the same thing. We want legislation that will ensure EWA products are available in Maryland and offered with appropriate safeguards that meet Maryland's historically strong consumer protection values and approach. HB 246 should be the basis for that conversation on EWA legislation. Senate Bill 998 represents an alternative approach to regulating EWA that hasn't previously been followed in Maryland
It's an approach that has features that aren't found in Maryland's consumer loan system. It contains no limits on the fees that EWA providers can charge workers to access their pay. It permits EWA companies to ask for unlimited amount of purported tips. It doesn't require EWA companies licensing. It allows EWA companies to meet lower standards than those met by every other licensed Maryland consumer loan lender. And it provides a minimal consumer protections on these products. No other financial service provider or consumer financial product legally offered in Maryland enjoys such latitude. In keeping with OFR's consumer protection mission, and in light of the fact that OFR has proposed an alternative bill on this topic, we must recommend that the committee give Senate bill, we must respectfully recommend that the committee give SB 998 an unfavorable report. Thank you very much.
Good afternoon. My name is Bill Meeks. I'm an Assistant Attorney General at the Consumer Protection Division of the Maryland Attorney General's Office. Consumer Protection Division opposes Senate Bill 998 because it exposes middle and low income consumers to predatory payday lending. Under clear current law, EWA providers are lenders and their charges are interest, requiring that they disclose their lending charges as an APR and subjecting them to Maryland's usury caps. Senate Bill 998 would exempt EWA providers from these requirements and other important consumer protections. The APR disclosure is important because it gives consumers the ability to understand the true cost of lending and compare it to other credit options. In contrast, EWA lenders' charges are very unclear, take a variety of forms, and they are not displayed as an APR. And EWA lenders' charges are also outrageously high. Studies have shown they average about 330% APR, which is 10 times the usury rate of 33% in Maryland. Under Senate Bill 998, there would be no limits at all on the interest that EWA chargers can charge. EWA lenders claim that they need an exemption from Maryland law to be profitable, but the CPD is dubious of this claim. For one, there's a little apparent default risk on these loans. The money's already been earned. Lenders have direct access to consumers' account ordinarily, and almost all the loans are repaid. It's our understanding that the lenders even make money sometimes from the free products they offer. In any event, there's no apparent credit risk or market factor to justify the excessive charges, often to low-income consumers who are desperate to get money, who are living paycheck to paycheck, and who studies show use these products repeatedly. The CPD also opposes SB 998 because it would legalize lenders seeking tips and donations. Calling these charges tips and donations is misleading, makes paying them sound generous or altruistic when they are simply finance charges. Providers sometimes use tricks and dark patterns to manipulate people into paying them even when the disclosures say they are not required. Additionally, Senate Bill 998 has a supposedly free option, but there's no guidelines. Providers can still ask for tips, and then these products can be structured to have little value, and the no recourse provision is not meaningful. Well,
I'm going to have questions for you at the end.
Please ask away.
Monica.
Good afternoon. My name is Monica Bergs, and I'm Policy Counsel with the Center for Responsible Lending. We are a nonpartisan research-based organization, and I am honored to be here today, not only to represent CRL, but also to represent family members that are workers in this state that I was just visiting with yesterday. This issue is very near and dear to me for many reasons, and what I've been hearing since I've been here is an earnest desire to help people who seem to find help in these products. But unfortunately, the current format of the bill that is in question does not provide adequate protections for people who access these products. And it's similar to negotiating a contract on behalf of a client who cannot be present. And one part of a contract is to define essential terms. What is a loan, right? What is a fee or a finance charge? This current bill sidesteps all of those essential terms and basically gives a broad range of actors to charge and operate their business model in the ways that they see fit, and in opposition to Maryland's existing strong consumer protection laws. So we are here graciously asking to be brought into the conversation so that the current format of this bill actually is altered to incorporate essential protections. A loan is an amount of money that you ask for that you have to pay back, and that usually comes with some cost. You can call it interest, you can call it a fee, you can call it a tip, but it's money that I have to pay back. And right now in Maryland, 33% is the policy decision that was made in this state to say that is the upper limit that is appropriate for people to pay back. This current bill sidesteps long existing protections, and it exposes to consumers to uncapped costs into perpetuity. So we look forward to your questions, and we look forward to further communication so we can get this in a place that's safe for people who access it.
Good afternoon, Madam Chair and members of the Senate Finance Committee. My name is Tammy Bresnahan. I'm the Senior Director of Advocacy for AARP Maryland. And we have a history of consumer protection. We also have a long history of against payday lending loans. And when you get a call right as the start of session from the National Consumer Law Center, your national office, and Tony Salzar's office, you think, well, what's going on here? What's happening? And I've listened to the testimony. This is our third bill hearing on this, and it does sound like a loan. We do thank you for the opportunity to discuss it. We thank Senator Klossmeyer for bringing this forward so that we can be open and we can have a discussion. ARP believes that EWA should be regulated as a loan subject to Maryland's loan laws. You've heard that over and over. Employers can continue to offer access to early pay for free as a benefit. I think Mr. Boston said if it looks like a duck and it quacks like a duck, it must be a duck. And I think that if it looks like a loan, it must be a loan. So we ask you to really consider this bill and the one that you may see on the House side. Thank you. And we're here for questions. Thank you.
Thank you. I'm going to start with Senator Reedy.
Chair, and I, at the risk of engendering your ire, I might ask one question of two different people. Thank you.
No, we don't have 140 witnesses today.
Fair enough. No, good.
We only
good.
have like 64, but
I understand.
Different.
So if I could start with our representative from the Attorney General, you talked about, and a couple of you mentioned this APR issue. So I agree we don't want people charging exorbitant usury rates. Payday lending, for example, quite often you could be paying, if you have a paycheck, you could be paying a tremendous amount of money to get your paycheck, and people fall prey to that a lot. However, a lot of these, based on my study of this, a lot of these folks that are using this service are getting, it's like a bridge of $150 or $100 or a couple $100. So a fee of like on $150, 33% APR on $150 is like $8. It's not unreasonable to be charged $8 to get access to an emergency $150. So when we use APR, it could be a little. Would you agree? It's a little different than we're talking about 33% on a $10,000 loan.
I'm sorry, I don't 100% follow what you're saying. I mean, I think that a 33% interest rate calculated on an annualized basis is essentially the same thing, no matter what the size of the loan is. On these loans, often they are very short term, right? 10 days. The people who need them are low income. They're pretty desperate. And the fees that are charged, while facially they seem, it's a couple bucks here, a couple bucks there. But if you annualize the interest rate out over the time point of a year, they end up being 330%. So if people use these products repeatedly, right? So let's say you take out a $300 loan over and over and over again over the course of a year. What you're talking about is you're paying $1,000 in fees for the right to use the same $300 that you already earned over and over again. And these are loans that are not only very short term, but they're also extremely low risk to lenders.
Well, you say low risk to lenders, but the lender actually has a lot of risk in that you could just walk off with the money and not pay them back. And the only punishment is that you can't use them anymore, right?
Well, a couple of points here. One is that the people who get access to this are people who have jobs, right? There's a job verification process. As I understand it, I'm not a member of the industry. This is what I've gleaned from the information that we've gathered. So these people have jobs. They've earned the money. They've already earned those wages. So the lenders know that the individual is going to get paid, right? So they know that there's money coming.
True. And
they have direct access, my understanding is, oftentimes to an account where that money is deposited. So essentially, the money comes in and boop, they take it out. And, there was some testimony yesterday. Perhaps some lenders have slightly different ways that they do this, but the thrust of the testimony was and that studies have shown is that these lenders get paid back at a very, very, very high rate.
If these people don't, and I'm not suggesting that I think a 33% APR, I'm not suggesting this is good financial management for anybody. But there are people who are in this situation, and unfortunately, there are people who use it repetitively. But I think a lot of folks, it's an occasional thing that they need in a pinch. You know, I just found out I've got to pay for some damage on the top of my house that is short of my interest deductible, and I just had a car repair I had to pay for. Now, thankfully, I have enough money in my bank account to be able to afford both of those. But if I was if it was several years ago, I might have been needing to figure out how to come up with a couple $100 extra bucks. And so I'm sympathetic to the idea that because if we don't have these products, and they have to be able to charge enough of a fee to make it work. So if we don't have these products, then aren't they pushed into something that's far more predatory without, I mean, I guess I'm not necessarily expecting you to ask that, but I think rhetorically I'm saying that's my concern. And I think I was going to ask another question, but Madam Chair, I'll just leave it at this, maybe to the department. I don't understand. It feels like y'all are saying we're okay with it as long as they as long as they can't make a profit. Because a lot of what you're laying out is that the reason they're having these ability for them to tip and the ability, that's because it really is not all that profitable if they're not able to do it this way. So I don't know if you could just comment on that, and that's all. Thank you, Madam Chair.
Sure. Senator Washington.
Senator, so one thing is, the department's not against, as I said in the testimony, right? So I think, we do appreciate the fact that the bill's in, we appreciate the approach. We recognize that the product can provide value. One of the big issues is that the way this bill is, and frankly, some of the operations is not consistent with the way Maryland operates, and Maryland has set up a system for regulating consumer loans. Other states have a different approach to regulating consumer lending. They may not have caps. They allow payday lending. Maryland does not allow payday lending, right? So we have a low cap. We're one of the lowest in the country. So the approach here that doesn't allow for licensing, that allows unlimited fees, that has consumer protections, but they're not the ones that all the other lenders in this state that we have under a current setup are required to follow. None of that is in this bill. I mean, there's nothing to say that they couldn't start with a fee now and say, oh, well, we got a foothold in Maryland and we're barely profitable, but now we got this bill that's going to protect us and the fees are going to go up, right? Because I think somebody talked about, who was it? Intuit bought Mint, and Mint went out of business because one of the comments was a business plan that depends on the altruism of your clients is not profitable and not a long-term business plan. So if you have a company that depends on tips, I'm thinking that that's not going to be a great business plan, and they're going to want to fall back on fees to increase, and there's no limit in here. So we think that the discussion should be had to talk about how we integrate this product into Maryland's system, not create a new system for this product, because we're worried that then opens the door to other one-offs on the consumer lending, right? You don't know where it's going to go from here. So as a department, we do believe, want to make it clear that these products are subject to existing law. So it's not like, there's no law on this subject. They are loans. The money that is advanced in most of these cases is not the worker's money. It is the money from the earned wage access company. They give that to the consumer. Then the consumer gets the money from their employer, which they've earned. And that then is the money that's used to repay the earned wage access provider. So CPD, I think Bill would agree, and us, he have no question that these are loan products covered under Maryland law. And if we do and can come to agreement on a bill, we'll be able to, put them into our system in a way that we all agree upon.
Thank you. And we're back to Senator Washington.
Thank you, Madam Chair. Thanks for being here. And I think you kind of answered my question at the end there, which was, there's arguments that this is a loan, it's not a loan. And I was just going to ask if you can just describe to us what is a loan? Define what's a loan and what would be covered for a loan.
Bill,
Sure. So the Maryland commercial law has a definition basically of what loan is.
In the short
it
way.
specifically
Yeah.
includes the words advances of money.
Okay.
And it also includes language that covers things like the purchase of earned wages, which is essentially what we have here. And the reason that the laws have been created that way and sort of altered over time is that, you know, basically payday lenders have been trying to call their products something other than loans and their charges something other than interests, since essentially time immemorial, you know, 1704 when the first usury rates came about in Maryland, probably. But Maryland's law and their definition of loan is very expansive, and to the Consumer Protection Division's mind, very clearly includes these products.
And what part of their product is consistent with that law that makes it a loan?
Well, you know, I think the Commissioner said it very well before, that essentially
because they said they don't charge a fee, they don't charge
they
interest. They do.
They do charge fees, yeah.
Okay.
And that's where the part about the interest in the APR comes in. So they charge these fees, and they charge these fees for the advance of the money. And that's why it's considered interest.
Yeah, Senator, the crux of it, I think, is that it's an advance with an expectation of repayment.
Got it. And that's that clear definition of a loan, right? Okay, thank you.
Thank you. Senator Mounts.
Thank you, Madam Chair. And based off of your testimony and explanation earlier, so the business transaction right now, there's no problem. However, at least what I've heard is that the business transactions that have occurred right now are not an issue. They're not a problem, especially about these different things. But it sounds like there's a concern that if this bill becomes law, then there'll be no control, and then fees will come, and then people could be taken advantage of, right?
No, right now they are, the providers are subject to Maryland law. We could seek to enforce Maryland law and have not yet done so.
Right, correct. But there's as far as the transactions that are occurring right now, as far as, well, I guess that's I'm asking a question you probably can't respond to. So a better question would be, as far as the bill and the issues raised, and there is not a regulatory framework that covers this, would reporting and disclosure and things of that nature resolve a lot of the concerns?
Well, to be clear, there is a regulatory system. That's our consumer lending.
I got you.
What we would like to do is put in place certain rules that relate within that larger framework, right? Adapt them to this bill. So right now, you know, when you do the calculation, it comes up to a really high APR, which is probably in violation of the 33%. Don't know, but you know, that's, if you do the math, that's probably where it is. So what we would like to do is have a conversation on how that those limits are enforced with respect to these products. Right.
But it would have to be an APR based evaluation. Is that what you're saying?
I don't know that. I think that's what we're having a discussion. Ultimately, Senator, it's a legislative decision on how we go forward in regulating these and where we put it within our current lending law. So
I just want to get a better idea of exactly what it was that you were looking for. So APR is not an absolute. It sounds, is APR an absolute determinant?
So APR is a great way to allow consumers to compare. So we want that in the mix to discuss where we are. I don't think right now, there's discussions going on between, you know, the department, industry, and over at the Economic Matters Committee. So I think, you know, we'll just let that play out.
Yeah, because I know we talked about this in other forums and things, but I think in this one, clearly APR doesn't work for the business model. So anyway, I wanted to verify that. So thank you very much. Yeah, sure.
In terms of APR, I know the committee passed out Senator Kramer's bill that applied the APR to the commercial lending sphere for small businesses because it was deemed to be good for transparency. So I think APR is a good transparency tool.
I understand. Thank you.
So I have a question about the APR.
Okay.
And I just want to understand it. And I am a bank board member, so I'm not totally stupid on APR. So we have $100 loan taken out and an $8 fee. Now, the companies told me they charged much lower fees, but let's just say an $8 fee. So it's going to be paid back in 2 weeks when the paycheck actually comes. So you're calculating the APR based on an $8 fee for $100 over 2 weeks. And that's why you say there's interest being charged, where they said you only charge fees and not interest, right?
Correct.
Okay. One of the things I heard you say is you want to have a conversation. And one of the things we heard from the prior panels, they tried to have a conversation and nobody was getting back to them. Can you clear that up for me?
I'm going to let Amy handle.
Madam Chair, we had a number of conversations during the fall with a variety of the companies that offer these products. And it became clear that it was going to be necessary for a bill to kind of clarify whatever was going to be the law in Maryland. The department proposed and is pursuing its own bill. The industry has Senator Klossmeyer and Delegate Fraser Hidalgo have put forward their own bills. And so the conversations are certainly ongoing, but we're certainly happy to engage in that.
You know, I do think it's a product that's going to have usefulness for some people. It's better to borrow $200 to pay your car insurance than it is to pay $150 fine to the motor vehicles for not having car insurance. And then you lose a good policy because you didn't pay, you didn't pay it on time, or you have a child that needs a prescription. And if you don't have prescription insurance, I mean, I can remember my kids, I had $100 antibiotics all the time because we didn't have prescription coverage. So I think there are emergencies and we need to be able to provide a good product that people can access at a fair and legal rate. So I think we're going to continue to work on this. I think we're done. Madam Klossmeyer.
Yeah, it just seems like this keeps going round and round and round. And but what I would like to say, number one, is thank you that you tried to catch up with me, but we were always in the wrong place at the wrong time. So, but I appreciate that, and I appreciate the secretary and Andrew and all of you coming. But are you, when I heard this bill, the very first conversation I had about it, I said, hey, this sounds really, really great. And so that was with Roger Mano, and then Frank Boston came along, had the same thing. And I said, okay, the first week, we'll get it all together. The first week of session, we're going to sit down and we're going to do the bill, and at that point, I had even talked to a gentleman in your department when I was at the MCE meeting. Mm-hmm. So anyway, then all of a sudden, as I said, people were just walking up to me and saying it's a terrible bill, yelling at me, and call me a scam, it's a scam and you name it.
I'm really sorry you had that experience.
It was very disturbing. This whole thing has been disturbing to me. So what I normally do, if I have a bill like this, I get all sides together and sit down and work it out. So you'll have a little bit and they'll have a little bit. Are you willing to work with the group?
Absolutely.
Absolutely. No, we recognize you had made that offer before to come in at the beginning of session.
And we tried that, and the very first day, I don't think we need a ton of people in the room. But the very first meeting I had, and everybody was yelling this and yelling that. And so we don't have a whole lot of time, but maybe we can get together a group and see what we can come up with.
Sounds great.
Okay.
So that ends this panel. I don't see any further questions. We are going to hear from one virtual witness, Garth McAdam, and he's favorable. Garth, are you there? Unmute for us. There you go.
Hi, yes. Thank you very much for the time today and the opportunity to provide testimony. I'm very cognizant that this has gone back and forth. So I think probably what I'll do is just keep my testimony as brief as possible. We are in support of the bill. We do want to just draw attention to the fact that In a survey of why our customers are using the service, 98% reported that they use it to pay for necessities, to avoid high fee alternatives, or for unexpected expenses. So this is access to liquidity, and that access is very real and often very urgent need for our customers. And respectfully, we believe that those advocating against EWA should also point to an alternative solution for these immediate cash flow needs. So otherwise, it's simply removing a low-cost financial tool used by thousands of Maryland workers and leaving them only with access to high-cost products like overdrafts. So I won't get into too much more details. So I do want to say thank you very much for the time and for the very, very thoughtful consideration of this bill. We are always available to discuss the actual and complete impacts of EWA on our customers. It goes beyond just the fee that they're paying. There's a lot of savings. There's reduction in absenteeism, which means more dollars, more wages earned. So there's a much more full picture and story that could be told about the impacts of EWA that we would be happy to share, and I'm sure others in industry would be happy to share. So again, thank you very much for your time, and we respectfully request a favorable report. Thank you.
Thank you, Garth. Do I have any questions for this witness? We have no questions. Thank you for testifying. That ends the hearing on Senate Bills 998, and Senator Lamb has requested that we hear Senate Bill 990 first. So Senator Lamb, that's the first of your two bills. And I think you have a panel.
We do have a panel.
I'm not sure which ones are your panel members, but feel free to bring them up.
I think we have Sarah Peters, Tommy Thompson, and Dan Rabbit, as well as Morgan Mills.
Yeah, and Morgan Mills too. Okay, there you go. Thank you.
All right. Well, good afternoon, Chair Beidle, members of the committee, and thank you for the opportunity to be able to be here to testify in support of Senate Bill 990. This is, for the record, Clarence Lamb, Senator District 12. Last year, I sponsored legislation to overhaul Maryland's law governing step therapy. You may recall that if you were on the committee last year. That bill had a provision in it to prohibit insurance companies from requiring step therapy when when a drug was needed to treat a severe mental illness. The House committee, during the process of last year's passage of that bill, removed this provision, which is being introduced separately in this bill. So in order to keep the larger bill moving, last year, our Finance Committee agreed to that amendment, which removed this provision that's now in this bill. However, at the time last year, there seemed to be consensus, at least in this body, that we should look more closely at the use of step therapy when it comes to mental health. So as a reminder from last year, step therapy is an insurance protocol that requires a patient to try one or more medications recommended by an insurance company prior to the drug being recommended by their physician. So basically, for example, if a patient switches from one physician to another physician, and their coverage might change because of a different insurance company, even though that patient was on one drug for their schizophrenia that had worked for that individual, they may be required then, when they switch to provider, switch insurance company, to have to start and try other medications first and fail those medications before they can get back to the medication that they were on before. So that hence why it's called step therapy or fail first therapy. As this committee has heard on other bills, this is another example of insurance companies questioning the clinical decisions of licensed healthcare providers in order to cut costs. Under this bill, insurance companies and Medicaid would not be permitted to require prior authorization or step therapy on a drug to treat a patient with bipolar disorder, schizophrenia, major depression, post-traumatic stress disorder, and other conditions as well. This bill also includes medication-induced movement disorders because, in addition to antipsychotic medications, the risk of a movement disorder, for example, called tardive dyskinesia, is a significant cause for many Marylanders to not want to take their antipsychotic medications. I know that this committee has heard a lot of testimony about how important it can be for mental health patients to access the correct care as quickly as possible. But I do want to point out the letters in the bill folder from Patricia Colley and also from May Morgan. Both of these letters are from mothers in Maryland who had watched their loved ones suffer simply because step therapy delayed access to care that they needed. Many patients with serious mental illnesses have tried and failed a long list of medications in their lives, it is their provider and not their insurance company who should be ultimately deciding which medication is most effective to treat them. Data shows that patients with serious mental illness also have difficulty taking their medications as regularly as other patients. Newer medications like longer acting injectables, which can last for up to 6 months, can be the best option, but are currently out of reach for many patients due to step therapy and also other prior authorization requirements. Furthermore, many patients with serious mental illnesses distrust the healthcare system. Putting these patients on a drug and having it fail first, when there's already a known drug that works for them, runs a significant risk of increasing that lack of trust, which can permanently result in patients discontinuing care. Data from the Medicaid program, for example, in Georgia, tells us that 61% of patients with schizophrenia who were required to follow step therapy for antipsychotic medications stopped taking those medications for at least a month, compared to only 41% who were not required to use step therapy. That's a 20% difference in failure rate of these schizophrenic patients who were on antipsychotic medications. A delay in starting medication caused by first having to get it approved under prior authorization may mean that a patient is lost to follow-up, or they may never return to care, or it may be impossible to contact them once the medication is finally approved by insurance. Therefore, step therapy and prior authorization requirements can be particularly harmful in psychiatric care. I know that the carriers are going to strongly oppose this, but we have already done this before. If you look at page 4 of the bill, you can see that the current law bans step therapy when a patient has stage 4 cancer, for example. This was done because the General Assembly recognized that delaying treatment for a patient with stage 4 cancer could mean that the patient loses their life. And Marylanders every day who are losing their lives may end up in jails and our streets and such because they're unable to get timely access to mental health care. If we figured out how to do this for stage 4 cancer, we ought to figure out how to do this for mental health conditions too. The carriers will also say that step therapy and prior authorization are cost-saving measures that are desperately needed to stop rising medical costs. However, data from Georgia's Medicaid program showed that implementing step therapy and prior authorization for antipsychotic patients with schizophrenia did save approximately $18 per month on medication expenses, but actually resulted in increased expenses of over $31 per month for outpatient services. In other words, step therapy programs may save money on medications, but those cost savings may be outweighed by simply shifting costs to more doctor's appointments. Under the current law, step therapy and prior authorization requirements apply to patients with serious mental illness. And this means that even if they're stable on their current medications, or if the provider thinks that that medication will work better for them, their insurance may require that they first try a different medication to go through a long, arduous process before they can get to the right medication. This bill builds on the section of existing law that prohibits step therapy for patients with metastatic cancer, already existing in the law, and hopefully builds on this as well. I'm sure that members have seen on the General Assembly website that the House has refused to give a hearing to this bill. The House refused to consider this issue last year too, but I hope this committee is willing to look more closely at this issue independently of the House committee's actions. The House has passed a bill to allow a judge, for example, to order patients to engage in mental health treatment. We've repeatedly asked about the coverage of bills covered under assisted outpatient treatment, but the answer is still unclear. We have a responsibility to get help for Marylanders who need serious mental health care. Passing an AOT bill without ensuring effective medication access at the same time for these patients would simply be an empty promise. I hope that this committee, if it's going to take up AOT, will also look more closely at how we can address insurance barriers that are further preventing Marylanders from accessing needed mental health care. Finally, the Department of Health has flagged for me that the current language of this bill could impact the department's ability to comply with federal law regarding the use of antipsychotic medications. I've requested an amendment to address this issue to ensure that MDH is able to comply with its federal obligation without impacting care. The department's letter also says that they expect this to cost $651 million, but I can assume that they didn't read carefully the bill and its contents. I met with Medicaid over the summer, and also based on a conversation that we'd included in an uncodified $2 million safety valve to void Medicaid provisions if there are significant cost increases. If the committee continues to be concerned about costs, we're also happy to drop the fail-safe cost threshold even lower. With that, let me wrap there and hand it over to other members of the panel, answer any questions at the end. Thank you.
And good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. Thomas Thompson on behalf of the Maryland Psychiatric Society and the Washington Psychiatric Society. First and foremost, I want to kind of go through the impacts that the illnesses that are enumerated in the bill have on individuals' lives. And you've heard this from our group many times as we come around for lobby days, and we testified on various bills like the prior authorization bill that's being considered by this body about what happens when there's a delay in treatment for our patients. And when there is a delay in treatment, that treatment usually is a combination of therapy and or medication. We see exacerbated symptoms. We see prolonged suffering by those individuals, an increased risk of hospitalization, and increased risks of incarceration, loss of job, loss of family, loss of relationships. All those things happen when there's a simple delay in treatment. And that delay in treatment sometimes is an artificial barrier that we see step therapy and or prior authorization to be. This bill takes the right step in treating those illnesses as unique because they are, and prohibiting the use of those barriers. What's very important, however, in this bill, at least from the doctor's perspective, is that this bill takes clinical judgment and allows it to be the overarching guide for that patient's care. It allows the prescriber to override step therapy protocols even if they determine that a specific medication is necessary, and that determination is based on their professional judgment and the individual patient's need. This is a very important bill in the mental health space. It's as important as Senate Bill 791 that you all are debating. And what I will note with my last 11 seconds is that the State Employment and Retirement Health and Welfare Benefits Program sees zero impact from this bill. Yet somehow in a similar bill, we have an unexplainable astronomical impact. I would ask you to look at these two bills together and please move favorably on them.
Chair, Vice Chair, members of the committee. My name is Sarah Peters, here on behalf of the Nurse Practitioners Association of Maryland and OTSCA. We're here in support of Senate Bill 990. In short, we don't believe someone who has serious mental illness should have to fail first on a covered product prescribed by their provider. I consulted a few psychiatric nurse practitioners who had a long list of scenarios in which this bill would be quite helpful. To name a few, and there's further examples in my written testimony. 1, a patient diagnosed with bipolar disorder failed multiple trials of mood stabilizers. Stable on one medication for over a month, but kept getting declined. It took multiple appeals to Maryland Medicaid to get approved. 2, patient prescribed one medication, but the insurer denied, saying that they would not agree because the patient was over 18. Providers started the medication because the patient was using substances, and the provider did not want to prescribe a controlled medication. The insurer denied the prescribed medication and recommended a controlled substance. We know creating open access and removing barriers for those with serious mental illness is beneficial. Over a dozen states have open access, including Utah, Oregon, Michigan, and Connecticut. The USC issue brief included today outlines the negative impacts of restricting access to psychiatric drugs, including increased hospitalizations and higher healthcare costs. Additionally, findings from Columbia Data Analytics compared Pennsylvania's restrictive access to Michigan's open access model, which has demonstrated that open access has the potential to lower overall healthcare costs and provide better patient outcomes. The study found that Michigan had lower healthcare utilization and emergency department costs, indicating better overall patient outcomes. This is further supported by 10% fewer hospital admissions, almost 4 days shorter length of inpatient stay, 6% fewer ED visits, and almost 5% fewer outpatient visits. I should also note most psychotropic prescriptions in Michigan Medicaid continue to be for generics, indicating that fears of prescribers opting excessively for brand drugs is unfounded. This is consistent across other states. For those reasons, we respectfully request a favorable report.
Thank you. Good afternoon, Chair, Vice Chair, and members of the committee. Morgan Mills here today on behalf of NAMI Maryland in support of Senate Bill 990. NAMI Maryland represents over 60,000 people with mental illness and individuals with lived experience across the state. This bill would prohibit health insurers and Medicaid from imposing step therapy or fail first protocols on individuals diagnosed with serious mental illnesses. There are an estimated 254,000 adults in Maryland with serious mental illness. Fail first can be a danger to the health and well-being of a person because fail first protocols often delay treatment. By requiring that patients demonstrate unsuccessful treatment on insurer-preferred medication, they aren't able to access the medications that they desperately need in a timely manner. As my colleague, Mr. Thompson discussed, when serious mental illness is left untreated or inadequately treated, the results can be devastating. It can also cause patients to abandon treatment completely. One study found that following the implementation of step therapy protocols, Maine Medicaid enrollees with bipolar disorder were 2.28 times more likely to discontinue antipsychotic drug treatment than their counterparts in New Hampshire who were not subject to step therapy. NAMI Maryland ran a survey earlier this year. We got 64 responses. Of those 64, 13 respondents utilized Medicaid and 30 had private insurance. Of those on Medicaid, over half had been subject to step therapy protocols. Those on private insurance, 73% had been subject to step therapy protocols. And in most instances, it took between 3 to 6 months to finally get the medication originally prescribed. When asked to describe their experience, people use the term stressful, dangerous, and life-threatening. One said their child became more aggressive, depressed, and disassociative. Another said my condition got worse and later required more attention. It became increasingly difficult to manage. One respondent even tried to take their own life because they were suffering so much without adequate treatment. Medication decisions should be between a healthcare provider and a patient, not insurance companies. In a moment, you'll hear from Ms. Cully, a NAMI Maryland member, who will describe her daughter's experience. And with that, we urge a favorable report. Thank you.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Dan Rabbit. I'm a policy director at Behavioral Health System Baltimore. BHSB is an independent nonprofit that serves as the local behavioral health authority in Baltimore City. In our role as an LBHA, we oversee the full range of mental health and substance use services in Baltimore City. A big part of the mental health services that we oversee in the public behavioral health system are services for those diagnosed with serious mental illness, such as schizophrenia or bipolar disorder. These interventions, such as assertive community treatment, are high-intensity interventions that cost more than the normal behavioral health services out there and are very challenging to see positive results. But without effective medication regimen, these sorts of programs rarely work. You really need effective medication with intensive wraparound services through ACT teams or similar interventions. Finding that right medication regimen is also really challenging. People diagnosed with serious mental illness respond very differently from one medication to the other, from one person to the other. So it takes a lot of time and a lot of effort for an individual and their prescriber to find something that works for them. Once something is found, it's critical to sustain them on that medication. Being forced to change into something that doesn't work as well can have long-lasting impacts. People's symptoms can become much more severe and never quite return to the level of symptom reduction that they experienced before. In addition to the resulting in trips to the emergency department or criminal justice involvement or worse. The fiscal note that was shared really only takes into account these increased costs from different medications. It doesn't take into account the severe costs from high intensity interventions if someone is forced off of an effective medication regimen. So we really implore you to support this bill to make sure that prescribing decisions are made between a provider and the individual themselves.
Do I have any questions for this panel? I don't see any questions. Thank you very much for your testimony. I have Ms. Burton favorable with amendment.
Good afternoon. I'm Evelyn Burton, Volunteer Maryland Advocacy Chair for Schizophrenia and Psychosis Action Alliance. Delay in prescribing optimal medication for each individual with schizophrenia or bipolar disorder increases the risk of active psychosis. Our families see the tragic outcomes of psychosis: increased homicide risk by 15 times, suicide by 4 times, increased rates of hospitalization, homelessness, victimization, and incarceration. The Maryland Secretary of Health recently said 25% of incarcerated Marylanders have serious mental illness. So what about cost? According to the report attached to my written testimony, the Schaefer Center for Health Policy and Economics said, quote, in other states, Maryland Medicaid formulary restrictions save little, if any, money on drug spending. Instead, formulary restrictions increase overall Medicaid spending, especially for inpatient hospital care, about 20% higher for those with schizophrenia and bipolar. Formulary restrictions increase spending on jails for mentally ill Americans. By 22%, it increased their risk of incarceration. My relative incurred $509,000 in 1 year when not on effective medication. The administration's concerned about increased Medicaid costs are unfounded because they are not taking into account savings from hospitalizations. Maryland just needs to try this and accurately calculate the net cost, at least for adults. Therefore, the amendments in our written testimony require cost calculations to include associated hospital costs. And I'll just say that giving legislative services authority to abruptly end the Medicaid exceptions is basically could be a death sentence or a sentence for incarceration for some individuals. It should be left to the legislature. Thank you.
Thank you, Ms. Burton. Thank you for your testimony. Do I have any questions for this witness? Thank you.
Thank you.
Matt Celentano is here unfavorable.
Madam Chair, members of the Senate Finance Committee, Matt Celentano here today on behalf of the League of Life and Health Insurers in opposition to Senate Bill 990. As many of you know, we passed a significant update to the step therapy law last session that became effective about 2 months ago. We haven't even had time to see the claims come in, as docs usually can hold on to those claims for 180 days. So we don't even know what the impact of that law is yet. We haven't seen claims on the brand new law that you worked on last year. So it's impossible to analyze the impact of that bill so far. As you all know, we're also on the verge of passing pretty significant prior authorization legislation on behalf of Senator Klausmeyer that would have major impact on drug approvals, timelines, appeals and grievance, changing carriers, standards and criteria. So I would say that we are going to continue to move forward with that sort of omnibus prior authorization language. As you heard earlier, the House cross-file to this bill has been withdrawn by the sponsor, and we urge an unfavorable report.
Do I have any questions for Mr. Celentano? No questions. Thank you. So next we have a virtual witness favorable, Patricia Culley. Can you hear us, Patricia?
Okay, I'm sorry. I'm not able to hear anyone. Would you like me to begin my testimony?
We can hear you. Yes, give your testimony.
Okay, but I will go ahead and
it's okay. We can hear you. I don't know what to do. We can't wait. You can go. Come on.
I'm not able to hear anyone. Would you like me to begin my testimony?
We can hear you. Yes, give your testimony.
Okay, but I will go ahead and
it's okay. We can hear you. Mary, turn your camera on.
Would you like me to begin my testimony?
I don't know what to do. We can't wait. Okay. I don't know what to do. This lady can't hear me, but Mary, you can start.
Everyone, would you like me to begin my testimony?
We can hear you. Yes, give your testimony.
Okay, but I will go ahead and
it's okay. We can hear
are
you.
you able to hear me now?
Who has the streaming on? Somebody has their streaming on. They need to turn the streaming
I'm
off.
sorry, I'm unable to hear you.
Okay. I don't know what to do. This lady can't hear me, but Mary, you can start. Everyone, would you like me to begin my testimony? We can hear you. Yes, give your testimony. All right. We just need to end it. Give an apology. We can't.
It's okay. You can hear me. Are you able to hear me now?
And then you have a technology glitch. We have Senator Elfrith back. We need to allow her to testify and leave because she's in budget voting and we need for her to vote on the budget. So, Senator Elfrith, you are Senate Bill 975 and you have Pam Casemeyer, Melanie Shapiro, and Kelly Marks. So Senator's going to testify. We're going to ask her questions and she's going to leave.
Thank you very much, Madam Chair, Madam Vice Chair, members of the committee. Thank you for the accommodation. It is budget day, so I've been reporting out the budget all afternoon and appreciate the flexibility before we go back and vote. Could I have my panel come up if they're here? Okay.
Pam Casemeyer, Melanie Shapiro, and Kelly Marks.
Okay, thank you. So briefly, Madam Chair, Senate Bill 975 is a reproductive health clinic security grant. It follows the philosophy we've recently adopted by the General Assembly to provide security funds for sensitive spaces that are unfortunately more and more under threat. And in this case, we are talking about healthcare clinics that provide critical life-saving healthcare to our communities. It's a very small one-time grant of $100,000. And that will also offset a position either between the Governor's Office of Crime Prevention and Policy or the Department of Health, depending on the committee's direction. Happy to work with you all on that. For physical security infrastructure in reproductive healthcare clinics, not security staffing or recurring funding. The bill as introduced, again, is managed by the Governor's Office of Crime Prevention and Policy, but up to the committee, of course, and your wisdom as to where best to house the program. But I think this committee is well familiar with the rising tide of violence and threats of violence to our reproductive healthcare clinics. In our testimony, we provided some statistics recently just on those threats to clinics over the last 50 or so years, but really there has been an uptick post the Supreme Court's Dobbs decision with significant increases in violence and threats at clinics in the last 2 years. Just a couple of startling statistics, but in those 2 years, incidents of stalking have risen 229%, burglaries rose 231%, arson rose 100%, anthrax and bioterrorism threats rose 100%, invasions rose 25%. So states that made the decision to shore up those protections, like Maryland, those protections on reproductive health rights, also saw a disproportionate increase in threats of violence and acts of violence. And that's also included in the testimony we provided. Unfortunately, the prosecution of these acts is not, as we can imagine, always as thorough as we would like. And so what this bill gets to really is how do we shore up the security infrastructure itself before these threats or acts of violence are actually made. Violence against patients, providers, volunteers, and clinics are threatening our rights to access reproductive health care. It's just that simple. Again, this bill is simple. It just establishes the one-time grant program. Just for the physical security infrastructure to support and guarantee safe access to care that this committee and the General Assembly has shored up over the years. It will provide meaningful security to patients, providers, volunteers. And Madam Chair, I think it's a complement to a lot of the work that this committee has done to make sure that access to care is guaranteed across the state of Maryland. That's just the bill in brief. Again, small, simple bill. And would ask a favorable report. I believe we do have one committee amendment, Madam Chair. Apparently, we have not defined reproductive healthcare clinic in law. And so we worked with some stakeholders to provide a recommendation to this committee to consider on how to actually define that.
Thank you, Senator. So do we have any questions for the senators so she can get back and vote on our budget? No questions. Thank you, Senator.
Thank you very
Thanks
much.
for your patience. Next, we have, is it Melanie or Kelly?
Melanie Shapiro.
Melanie, thank you.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. Melanie Shapiro, Public Policy Director with the Maryland Network Against Domestic Violence, Maryland's federally recognized state domestic violence coalition, here in support of Senate Bill 975. I did testify previously regarding some of the statistics with the intersection of domestic violence, a form of domestic violence, reproductive coercion, and the access to reproductive health care. Some additional statistics that you should be aware of is that between 66 to 22% of women terminate their pregnancies because they're in abusive relationships. and 2.1 million women in the United States have become pregnant as a result of rape by an intimate partner. And there was one study that showed that in fact, 16% of survivors with rape-related pregnancies decided to exercise their right to choose and sought an abortion. Ensuring that they can safely access that care is of the utmost importance. They're already experiencing a tremendous amount of violence, and what this bill would go to is ensuring the safety of the individuals seeking care, the care providers. One of the services that is offered through the comprehensive domestic violence programs is safety planning. And if somebody needs to have this additional aspect of that safety planning, is how does a victim who needs reproductive health care, whatever that care might be, access that care? And to the statistics regarding stalking, I believe it's 40% of stalking victims are in fact victims of intimate partner violence. So in addition to the direct threat to the reproductive health care facilities, there is an additional risk of an abusive partner using those air tags, using those tracking devices to track their victim as they're seeking the reproductive health care. So for all of those reasons, we think that Senate Bill 975, ensuring the safety of patients and healthcare providers and those facilitating reproductive health care, that Senate Bill 975, we urge a favorable report.
Thank you, Melanie. We have Pam Casemeyer at the table.
Hi, Madam Chair, members of the committee, and I apologize to all of you and to Senator.
Don't tell me you were at the House.
I wasn't going to, well,
Okay.
no, I'm not. Anyway, because this bill is really a priority, and for the American College of Obstetricians and Gynecologists, similar to what you heard from us earlier on the first bill of the day, this is analogous, and this is all about that security, protection, finding a way to make sure that providers and patients and their families are safe. So you've had a long day. I won't take any more than that, but I did want you to know that ACOG finds this to be a really good initiative, and hope that between all of this, you'll find a way to help create the funding for these kinds of services.
Thank you. We have one more person for your panel. It's Kelly Marks, and she's virtual. Kelly, there you go. Thank you.
Hi. Yes, my name is Kelly Marks. I'm with the Washington Area Clinic Defense Task Force. I'm an active clinic escort at the Planned Parenthood in downtown Baltimore. These ladies before me have already testified about why we need funding, but those include, in my personal experience as an escort, witnessing physical violence, following people to their cars, taking photos of license plates, and I've had my own photo taken, which have been posted in various ways. There's also examples of verbal abuse. So for example, we have 109 people who have been trained to be clinic escorts at my clinic alone. And over the course of January and February, there were a total of 52 shifts, which requires 104 different people. And we only had 30 people who volunteered that entire time. And we still had our shifts covered. But that just means we're putting a lot of pressure on unpaid volunteers to stand outside in any weather and make sure that, you know, people are able to access things that they have the legal right to pursue. Why do people not volunteer, or why do people not want to show up? Part of that is because you get verbally harassed, physically abused, some things that you might hear on a typical shift. You're murderers. How do you sleep at night? You belong in hell. I hope you go to hell. You're participating in the dismemberment of babies. This inflammatory rhetoric leads passerby to often join in on the harassment, and there have been various instances of physical harassment. Police are often called, which pulls them away from other things that they could be doing. So yeah, 30 people can't be expected to do this on our own. We really need extra help in terms of different things, like different doors and that kind of thing. You've been presented with a rare opportunity to offer aid to individuals who may be at the most vulnerable points in their lives, and I really hope you take the opportunity to do so. Thank you for your time.
Thank you, Kelly. Now, do I have any questions for the sponsors panel? Senator Reedy.
Thank you, Madam Chair. Can I just ask maybe Melanie or Pam? So this is the second bill we've had today trying to use taxpayer funds for abortion infrastructure, basically. And, you know, I'm looking at the statistics here about rising crime aimed at that's related to abortion and abortion clinics. It's interesting that, Christopher Wray testified before Congress, I think last year, that 70% of the abortion-related violence that's been reported to the FBI was actually on the other side of it. Not the pro-life side, so to speak. And of course, no one should ever threaten violence against anybody, and that's not appropriate. But we're talking about a multi-million-dollar industry. Why are we picking this one? I can think of a lot of security needed in a lot of places dealing with healthcare. So, but why this and why now? Why $500,000 just for one industry that already gets a lot of taxpayer funding? I mean, Pam, maybe if you want to take a stab at that, or
I think it's because we've seen an increase in violence. I mean, just like you are dealing with violence issues in other areas with other things, and even in other committees, not in this committee. We're seeing an increase in violence and threats and a concern that these are putting our healthcare providers at risk. I think so. It's really a focus to try, because there's long-term cost implications for the state and healthcare. I mean, if these people are on Medicaid or others, if you've got health issues that occur because of actions that happen at the clinics that put people at risk, it's not a straight line exactly how the dollars flow one way or another. But I think we have, as a state, when there have been changes in the environment where there's a significant increase in the risk of harm or violence or challenges, that we've looked to find mechanisms to solve those. And I think that's what this is. And this is a recent, what we're seeing play out since the Dobbs decision and all of that. It's gotten much worse.
thank you. I'd like to see maybe, and I don't know if you were, this may be more of a question for the sponsor, but in her testimony, she lays out some very startling statistics, but they're nationwide. So I'd love to see some information from Maryland offline. If you'd send it to us, we'd appreciate it.
We'll see what we can put together.
Thank you very much.
Senator, I don't see any other questions. So that ends the sponsor panel. Thank you all very much.
Thank you.
Thank you.
We have two unfavorables here and then one virtually. So Mark Crosby and Laura Bogley, please come to the table. And start as soon as you're ready.
Thank you again, Madam Chair, members of the committee. I'm Laura Bogley, Executive Director of Maryland Right to Life. And on behalf of our directors, I oppose this bill. Strongly oppose this bill that would appropriate public grant funds to further subsidize the multi-billion-dollar abortion industry and divert public funds from legitimate reproductive health care services. We strongly oppose the use of public funds to finance abortion facility infrastructure. And this bill does not pass the straight face test. Bill proponents are attempting to distort reality and manufacture a crisis in order to extort additional taxpayer funding to further enrich the multi-dollar abortion industry. Where is the Maryland data to support this? Where is the need? Who has shown the need with Maryland-specific crime data? You won't find it. The false premise and defamatory claims that abortion facilities in Maryland are facing increased threats of violence from pro-lifers, and they therefore require millions in taxpayer subsidies to enhance facility security. As I testified earlier, FBI Director Christopher Wray testified that 70% of the cases of violence or threats of violence that they are reviewing right now is pro-abortion extremist violence against pro-lifers, not the other way around. Many of these violent crimes are against people who are just simply practicing the tenets of their faith. Many of them praying peacefully outside of abortion clinics. And so this really should be classified as hate crimes. But instead, we've seen no charges, no prosecutions. State of Maryland has no legal obligation as members of the Finance Committee. Abortion's legal through all 9 months for any reason with taxpayer funding. You have no legal obligation or constitutional obligation to fund abortion, particularly not any type of expansion of infrastructure for abortion. If the state elects to do so, it must provide equal protection under the law for pro-life citizens as well, and provide equal accommodation for pregnant women who choose life. We strongly urge your unfavorable report. Thank you.
Thank you. And Mark Crosby.
I'm Mark Crosby. I'm 73. I'm very pro-life. I'm exceedingly non-violent. I don't know of any, you've had two people testify on the violence. I haven't seen it. It's against us. On the 26th of May last year, I give out rosaries in the Planned Parenthood area, praying the rosary. That day on the 26th, a man came down from the south in front of Planned Parenthood and got in a football position, and my 85-year-old friend Dick was in front of the side of Planned Parenthood, and he got in a football position and knocked him into the concrete planter there and into the plate glass window, knocking him out. I came over to help. He punched me twice, grabbed my chain around my neck, threw me down, hit me again, and kicked me in the face. I ended up in shock trauma. I needed 3 surgeries. I was blind in one eye. I need surgery on this hand, my knees. I need medical attention on my knees. That was me on the 26th of May. We are non-violent. We're pro-life. They're losing Planned Parenthood is losing volunteers because they realize they're killing babies. That's why they're losing volunteers. They're spinning it. We're non-violent.
Thank you for your testimony. I'm very sorry that that happened. We have one virtual person to testify, and I think we're going to have a problem with her audio, but we're going to try. Her name's Linda King. She's unfavorable. Linda, you can go ahead, but we don't see your icon for your microphone. Linda, we can't hear you, and we don't see your microphone icon.
Excuse me.
Okay.
You can hear me now?
We can hear you now. Thank you. But now we've lost your video. Let's give her a minute to come back in.
No, she's.
Meanwhile, are there any questions that you have for Ms. Bogley or Mr. Crosby? Any questions at all for this panel? I don't see any questions. Senator Mouse, go ahead.
Thank you, Madam Chair. And Laura, thank you for your testimony. And with regards to this legislation, I know I'm familiar, and we've worked on this with securing or providing security for pregnancy centers, particularly in my district, that have come under different types of threats and things like that. And I saw on Senate Bill 947, the first bill today, there was testimony from a pregnancy center in Frederick that had been vandalized and people had spray painted it and things like that. Do you think it would be appropriate to, if this security grant funding were made available to service facilities that provide abortion services or family planning, that it also be made available to facilities that provide other information on pregnancy and things like that?
I appreciate the question, Delegate. Certainly, any trickle down federal funds that we have under federal Title IX would be required to provide equal accommodation. So whatever you do for the benefit the termination of pregnancy, you would need to do for pregnancy and people that choose that. And I do want to also mention there was some information about forced birth but nearly 3 in 4 women say that they were coerced into abortion. And that can often be just because they're not provided options. So again, with the abortion monopoly and only disproportionately funding abortion in our state, women are not given alternatives, life-saving alternatives to abortion. And so that's the state being engaged in complicit or constructive abortion coercion. So I would certainly recommend that, but I think to Senator Reedy's point, why just single out either abortion facilities or pregnancy resource centers? Why would we not then apply this standard to any business? Any business that is making a profit in the state of Maryland? Why would they not also then deserve taxpayer funding for their infrastructure and security improvements? So again, this is favoritism, it's abortion bias, and that's why we are asking for an unfavorable report.
Thank you.
And oh, here we go. Here we go. Linda, can you hear us? Linda, can you hear us? She's trying to connect to the audio.
Are you able to hear me now?
We can hear you now. Thank you.
And see me?
We can hear you and see you, and you have 2 minutes. Thank you.
Okay, thank you, Madam Chairman and distinguished members. My name is Linda King, and I am the Executive Director of the CareNet Pregnancy Center of Frederick, Maryland. I am thankful for the opportunity to provide testimony in opposition to SB 975 and am asking this committee for an unfavorable report. We have served the community for 41 years, providing free services to support pregnant women who would otherwise fall through the cracks. Our center is located in the heart of downtown Frederick and has been the victim of repeated acts of violence. Most recently, on May 4th, 2022, the staff arrived at the center to the disturbing scene of graffiti spray paint on the front of our building. Phrases such as "not a real clinic," "end forced motherhood," "pro-abortion, go to PP instead," and "abortion is a right" were spray painted in black and red paint. This happened after the SCOTUS leak of a draft opinion regarding Roe versus Wade. This shocking display was frightening, but we continued to serve our clients that day. With the added threat for violence if Roe versus Wade was overturned, we quickly needed to take steps to enhance our security measures to protect our clients, volunteers, and staff with the following: armed guards for a 2-week period, installation of 6 security cameras, protective film over the doors and windows of the lobby, installation of a panic arm on the entrance door, installation of ground floor window sensors. The cost of expanding security was over $14,000, which is very significant to a nonprofit organization. All of our services are provided free of charge, and we primarily are funded through churches and individuals receiving no government money. Unfortunately, this is not the first time our center has been vandalized. In March of 2014, a brick was thrown through the entrance door, shattering the glass, with the same kind of graffiti spray painted at our entrance, on our center sign, and various parts of the building. Again, in September of 2014, we were once again faced with vandalism with the same kind. So I thank you for this time, and in closing, I'm asking for an unfavorable vote on SB 975.
Thank you. Do I have any questions for this witness? I see no questions. Thank you for testifying. Glad your technology worked out. Thank you.
Thank you very much.
Testimony. Senator Lamb, we're trying to reach Senator Rosapap, who's in budget. I'm going to give him a minute or two. And let's
May I say one more thing? In my case, where's the police?
No,
where's the FBI?
The hearing has ended.
Where's the hate crime?
The hearing has ended. Thank you. No, Senator Lamb, you want to do your bill? We can't reach Senator Rosapap. Senator Lamb, do you have a panel? I see some people signed up. I don't know if they're your panel.
I do. So we have Liz Elliott, Robin Elliott, Catherine Kirk Robbins, Kristen Ayers, and Swati Singh.
Do we have enough seats? Looks like we do. Everybody, will you please come up? Once Senator Lamb testifies, then we're going to start at you and go right down the row. Okay, thank you. Budget voting. So this is a real quick bill. I'm sorry.
Calm. But you look great.
No, he's got a
I
couple.
wish you were all here for my bill.
I got the
so-
best I can do.
Thank you very, very much, Madam Chair. We are in a voting session. So this is a bill basically to protect financial consumers. We have a lot of problems with scams where money is taken away because someone gets to do a wire transfer. Some of you may have experienced that yourself or have constituents who have experienced that yourself. The bill is designed to create a new regulatory structure in Maryland to try to protect folks like that. And that concludes my testimony.
Senator, thank you for that. We'll let you go back to
Thank you.
committee. You've
Thank
got a
you.
panel of people we can ask
Thank you.
questions. Thank you. Vote good, okay?
Thank you.
Who would like to go, Karen or Emily?
I'm Emily,
Okay, Emily, you can go.
or I guess I can sit here. Hi. Thank you to the committee for giving me the opportunity to speak today. My name is Emily Bryant. I'm a social work intern for the Economic Action Maryland Securing Older Adult Resources Program. Today is my first oral testimony, and I'm testifying in favor of Senate Bill 930. In the last 6 months, I have worked closely with older adults while assisting them in applying to various government assistance programs. Throughout this time, I've been exposed to many heart-wrenching details regarding the vulnerable financial situations that many older adults face, and this vulnerability has only increased with recent advances in technology. Advances in the digital world, like the use of AI or even things as simple as email, are being used to scam older adults and strip them of their hard-earned money. Under current law in Maryland, older adults that fall victim to these scams are forced to go after scammers themselves. This can be dangerous and expensive, making it an impossible task to ask of victims of wire transfer fraud, especially when hardworking and low-income older adults are the common victims. Passing Senate Bill 930 would ensure that consumers are not held liable for scammers' actions while holding banks accountable and allowing victims of fraud to sue their banks privately. Myself and those at Economic Action Maryland ask the committee to vote in favor of Senate Bill 930 to help protect older adults from scammers and ensure banks use their expertise to protect this vulnerable population. Thank you for your time.
You and Karen.
Yes. Thank you, Senator Bidel, members of the Senate Finance Committee. For the record, my name is Karen Morgan. I am a volunteer advocate with AARP Maryland and a member of the Executive Council. We're here in support of Senate Bill 930. And Senate Bill 930 brings up a very important question. What is an authorized transfer? Because we have found stories of people who've done everything they thought they were supposed to do, only to find that their money's been stolen, and it really is through no fault of their own. And if they'd known, if they had clear, transparent information about what they were doing, they never would have pressed yes or agreed to do that particular transaction. AARP published a story about a couple that was in the midst of downsizing, and they scrupulously followed every direction that their real estate agent and title agent gave them, only to find that the money that they thought they were transferring to their real estate attorney's account had been stolen by a crook. And it was hundreds of thousands of dollars, their life savings. They lost the house that they were moving into, and because they were planning retirement, it's not like a new job was on the horizon. The other issue here is that if my debit card is hacked and somebody buys a pack of gum, I've got the full weight of the banking industry and the credit card industry or whatever the financial industry to protect me from the person who's buying that pack of gum. But if I'm transferring hundreds of thousands of dollars to buy a house, I'm just left to my own devices, and I just have to hope that everything works out okay. That's not acceptable. This bill would set up some reasonable guardrails to regulate and protect wire money transfers. That's why we're in support. Thank you very much. We ask for a favorable report.
Thank you. Do I have any questions for this panel? Seeing no questions, thank you for your testimony. We have one in opposition, Mr. Enton.
Thank you, Madam Chairman, members of the committee. Robert Enton on behalf of the Maryland Bankers Association. We're very strongly opposed to
this piece of legislation. We have in Maryland and in every state in the country what's called the Uniform Commercial Code. Article 4A of the Uniform Commercial Code, which is in place in every state in the country, deals with wire transfers. In addition, we have the Electronic Funds Transfer Act, which governs this activity at the federal level. No state in the country, not one, has adopted the provisions that are in this bill, not one. Secondly, I would tell you that the fiscal note says on the very last page, on page 4, is that the Office of the Financial Regulation, the Maryland Bank Commissioner, notes that this bill may place Maryland chartered depository institutions at a competitive disadvantage of other states and national states, as those institutions would not be subject to the bill's requirements. And that's one of the reasons that we have a uniform commercial code. It's one of the reasons that the federal government has dealt with this issue, because as you can imagine, wire transfers go from state to state, from person to person, from bank to bank. And the whole idea is to have a consistent set of regulations. The Uniform Commercial Code is put out there by the what we call NCUSL, the National Conference of Commissioners on Uniform State Laws. And those bills come in front of this committee. They come sometimes in front of the Judicial Proceedings Committee or the Judiciary Committee, but that's the process by which these multi-state issues typically get dealt with. If there's a problem with this, with the current law, then that's where the solution needs to come, not at the state level and not in a state where no one else does it. So thank you.
Thank you, Mr. Enton. Do I have any questions for Mr. Enton? Senator Kramer, I almost called you delegate. Senator Kramer.
Thank you, Madam Chair. All right, Bob, what is the heart of the problem where, and I've heard about these issues where, and evidently settling on homes seems to be a big part of it, where monies get wired, I guess, as part of the settlement, and somehow the money disappears. What's happening with that? Are you familiar with it?
I'm not sure. I think every case is somewhat different. Look, this committee has dealt a lot with fraud this year and fraudsters. And, fraudsters are very creative in what they do. Article 4A of the Uniform Commercial Code deals with the issue of fraudulent activity, sets forth what the standards are, when the bank is going to be responsible.
I get that's, thank you. No, I get all that. I'm just saying, where is the weak link in the chain that this is occurring? So if we have a problem and this is happening with these wire transfers, and maybe you're just not the right person to be asking, but somewhere there's a weak link that this is happening. And I guess, you're saying this bill's not going to get to that issue, but I guess my question is, how do we get to the
Well, I think that's a very valid question, Senator Kramer, and I'm happy to, get one of our, the experts. You do have the written testimony from the State Bar Association, which discusses what the current remedies are in the event of fraud. But, fraud changes every day. I mean, if we need a stronger anti-fraud statute to go after the fraudsters that are stealing this money from Maryland consumers, and we have supported all kinds of elder fraud legislation, we'd be happy to work on that and support it.
Well, and the goal is hopefully to keep it from happening, so we're not after the fact trying to deal with it, but prevent it up front. But maybe if you think there's an opportunity, my recollection is at one point in time, that may not be the case anymore. You did represent one of the wire transfer companies, if I recall correctly. And if not,
I just represent the banks, not the wire transfer.
Okay, I thought at one time I was mistaken then, because I was just curious, trying to get a handle on where the weak link is. And I've been hearing more and more of this happening. I was just wondering if you had a handle on that. So thank you anyway, D. Robert.
Thank you, Senator
Madam
Kramer.
Chair.
You. I don't see any other questions. That ends the hearing on this bill and our final bill. Thank you, Senator Lamb, for your patience. The Senator Lamb's Bill 989, and he can bring his panel back up to the table. And I apologize to everybody, but when committees are voting, particularly when budget is being voted, it's important that they be in committee. So thank you all for your patience. Last bill of the day. Thank you.
Good afternoon, Chair Beidel and members of the committee. Thank you for allowing me to testify in support of Senate Bill 989. For the record, Clarence Lamb, Senator in District 12. The purpose of Senate Bill 989 is to limit the total amount of cost share for prescription epinephrine injectors, also known as EpiPens, for individuals with eligible health insurance plans to no more than $60 for a 30-day supply. $60 for a 30-day supply. That is regardless of the type or amount of epinephrine that's prescribed. I'm sure that many of this members of the committee are familiar with this issue, as we've seen extensive reporting over the last few years related to the skyrocketing prices of EpiPens and the accessibility issues that are related to it. According to the CDC, life-threatening food allergies are on the rise, doubling over the past 20 years. In Maryland, an estimated 622,000 people, or about 10.7% of the population, have a life-threatening allergy, with 102,000 of these being children under the ages of 18. Despite the necessity of these prescriptions, the cost of EpiPens in the United States has increased by 537% in just the last 11 years. In 2007, a two-pack of EpiPens cost $60. And in 2016, the same two-pack cost $600. This is not because it's become more expensive to make. In fact, I want to make sure that the committee is aware that EpiPens cost about $8 to make, and the epinephrine hormone itself is just around $1. It's been the subject of apparent price gouging that ultimately relies on patients to help foot the bill. Compared to other developed countries, the out-of-pocket costs for EpiPens are drastically higher. This price rise is vastly disproportionate to production costs and annual inflation, and it poses a very real threat to people living with life-threatening allergies, many of whom must make an unfair decision between a life-saving drug and putting food on the table. We've reached out to the Maryland Healthcare Commission to gather some data on how much Marylanders have been paying for epinephrine, and in 2022, fully insured Marylanders were paying about $206 out of pocket. Compounding these affordability concerns is that food allergies and anaphylaxis also affect individuals from socioeconomic backgrounds that are lower at a higher rate. Black children are more likely to have food allergies than white, Asian, and Hispanic children, and the risk of fetal anaphylaxis is growing at a faster rate amongst Latino and Asian American children. On a day-to-day basis, non-public schools and summer camps also require that a child with allergies provide their EpiPen, inhibiting families who are financially struggling from receiving childcare if they cannot afford their medication. The cost and impact of patients who need EpiPens is not trivial. Due to this financial burden, many individuals decide to forego the cost and risk lethal reactions. In 2021, the Food Allergy Research and Education Organization, also known as FAIR, conducted a survey of nearly 6,000 food allergy patients and families. 91% of those who responded earned less than $75,000 per year, and the cost was the primary reason why epinephrine auto-injector prescriptions were either left unfilled or not refilled. In Maryland, 52% of private sector employees are in a high deductible health insurance plan. For a typical family living in Baltimore with a child with peanut allergies, they must purchase every year at least 2 packs of epinephrine auto-injectors, one for at home and the other for at school. Their annual cost of $1,400 is nearly 70% of the median monthly mortgage payment in Maryland. While I wish we have the authority to propose more expansive remedy at the state level, this bill represents an attempt to help mitigate cost sharing for the types of plans that the General Assembly is able to regulate. With no action done to control list prices, we determined that other solutions to controlling the cost of EpiPens is just not viable. The major pharmaceutical companies control the patents. Even the more cost-effective generic is still incredibly expensive, priced at over $300 for a 2-pack of EpiPens. The inaction of the federal government to help regulate the cost of EpiPens has allowed major pharmaceutical companies to continue to raise their prices. Capping drugs for the benefit of our state is not unfamiliar to us. In fact, in 2022, the Insulin Cost Reduction Act was passed that capped insulin at no more than $30 per month, which has helped residents across the state and has not affected insurance premiums. Colleagues, this bill is a quintessential kind of work that our constituents send us here to Annapolis to do. Passing legislation that has a material effect on the lives of Marylanders is what we were elected to do and what we're asking for support for on this bill. While we know that how to treat a lethal allergic reaction with medication, oftentimes the big pharmaceutical manufacturers and the lack of action at the federal level combine to lead to inaction from health insurance providers to help institute us to come up with policies to make sure EpiPens are affordable and available to everyone who needs it, and to create better long-term health outcomes for Maryland residents. With that said, let me close here and turn it over to other members of the panel. Happy to answer any questions at the end. Thank you.
Good afternoon, Madam Chair and the members of the Finance Committee. My name is Kristen Ayers, and I'm in support of Senate Bill 989. I'm here as a parent of children with severe and life-threatening food allergies to peanuts, tree nuts, wheat, egg, and finfish. Protecting my children, it's kind of like the National Preparedness Plan with the 5 different mission areas: prevent, protect, mitigate, respond, and recover. And epinephrine is a big part in each one of those areas. But kind of to give you a broader perspective in terms of how we use it, it's in multiple places. As Senator Lamb mentioned, it's not just one set. We need a set to have on our own. Our children carry a set in their backpack. The school nurse has a set. A set goes with their grandparents. We need it to be in a specific place in their home so they can remember in an emergency where it is. Camp counselors will want a set. They often ask to keep that set for the duration of camp so that you're not getting the exchange back and forth. We spend about $1,000 a year on epinephrine. We can afford it. I know there are a lot of families that cannot afford it. And so I want to take a step back and explain that training children from when they're diagnosed, my daughter was diagnosed when she was 10 months old, through their youth is a challenge. You send a message to a child when you cannot afford an EpiPen for them. We need to do this not only to protect their life, but also to help them and the people around them understand how serious this disease is. It is not a diet. We need to help these parents who cannot afford it have their own epinephrine pen for their children. Thank you for your time.
We're just going to go this way. Dan. Thank you.
I can almost say good evening. I am Elizabeth Elliott. I'm the president of the Maryland Association of School Health Nurses, and my mission is to help our state's children grow into healthy and thriving adults. We are in strong support of Senate Bill 989. In a classroom of 30 children, 2 or 3 or 4 of those students have anaphylaxis. And school nurses know that the immediate necessary treatment, if a student is experiencing anaphylaxis, is epinephrine. However, because of high out-of-pocket costs, many Maryland families don't have immediate access. Oftentimes, in a school health room, parents will provide one EpiPen to keep the other EpiPen at home. However, epinephrine needs to be provided in a twin pack because it only lasts 10 or 15 minutes. And so a child would get one EpiPen at school, and hopefully EMS would get there in time, but maybe not. And then they wouldn't get the other life-saving medication. And they would also be at risk in the home setting.
And this situation really comes down to equity for our children whose families cannot afford $1,000 a year per child for multiple sets of epinephrine. Where are they left? Those kids are left at risk. In addition, sometimes parents don't disclose anaphylaxis because they can't afford the medication, and they can be a bit embarrassed about that. And so we don't know the child is anaphylactic in school, and we can't help support that child and advocate for their health needs. Again, we strongly are in support of Senate Bill 989. Thank you for your time.
Thank you. Okay.
Good afternoon. I'm Dr. Swati Singh. I'm a board certified emergency physician, and I've been working in PG County for the last 10 years. I'm really honored to speak with you today about capping the cost of EpiPens for patients with life-threatening anaphylaxis. I'm a mom with a child who has life-threatening nut allergies, in addition to an EM physician who's taking care of many patients who need anaphylaxis immediately upon arrival to the ED. It's important to understand the medication is prohibitively expensive to buy, even though it's inexpensive to make. That makes it out of reach for my patients in PG County. It expires on about a yearly basis, and people need multiple doses of the medication, as mentioned before. It's also a labile medication, so if it gets too hot or too cold, it needs to be replaced. All of those things make the medication expensive and increase the cost burden to our patients. It also needs to be administered within 30 minutes of a suspected anaphylactic reaction. If you wait beyond that time period for a severe reaction, it does not matter how much epi you give, you will not save the patient's life. So easy access to the medication is extremely important. And I've seen the impact of inaccessibility to this medication up close and personal in caring for my patients. I once had a patient who was 18 years old. He looked perfect. As I was taking his clothes off his body to resuscitate him in the emergency department, he looked like an anatomy textbook, but he came in with his pupils fixed and dilated, which means he was brain dead. His blood pressure was extremely low. And his mom told me the last words that he said to her were, "I can't breathe," as he collapsed. They did not have an EpiPen, and the ambulance rig could not get to the patient in time. He died, and he did not have to, because he did not have access to a medication that his family could not afford. I strongly support capping the bill of this medication so that patients do not have to negotiate the price or cost that they have to pay. That should be left to PBMs or other places who have the time and the resources to make those efforts.
Good afternoon, Robin Elliott here today on behalf of the Maryland Nurses Association in strong support of this legislation. Both adults and children may have anaphylaxis, but this issue disproportionately affects children. You have in our written testimony some citations of research that shows that in Maryland, 63% of claims in 2022 for epinephrine were for minors. So this is a issue about equity for children. As my colleague with the school health nurses mentioned, we really want to make sure that families can afford to have the 2-pack, which you've heard is so important, in every location that they need. We ask for a favorable report. Thank you.
Good afternoon, Catherine Kirk-Robbins with Maryland Healthcare for All. Thank you, Madam Chair and members of the committee, for the opportunity to testify in support of Senate Bill 989. You have our written testimony, so I'll just strike home one point, and that is Marylanders are hurt by the high cost of epinephrine auto-injectors. It is one of the most common prescription drug products that we hear patients tell us they are struggling to afford. On a more personal note, I became familiar with the issue when my son was diagnosed with a peanut allergy. It cost us roughly $600 each year for 2 twin packs of EpiPen Juniors. Generics would likely provide a more affordable option. The main issue there is an EpiPen Junior is a 3-second injection, and the generic prescribed is you have to hold the pen in place for 10 seconds. I don't know if any of you had tried to wrangle a toddler lately, especially with a needle in their thigh, but the 7 seconds is a big difference. So I make that point just to highlight that this legislation would offer some cost continuity across products that would be really meaningful to a lot of Maryland patients. I also want to add that our hope is that the Prescription Drug Affordability Board could review this issue sort of with the scope of the entire supply chain in mind if and when they are granted expanded authority. But Maryland patients can't afford to wait, and this would be a meaningful issue. So thank you for your consideration.
Members of the committee? Okay. Oh, Senator Mouse?
Has anybody tried getting the EpiPens from the Canadian pharmacies? Some of these other places where people are going to get their drugs? We can say no.
Nope.
No.
No.
Thanks. Thank you.
Any other questions? Anybody want to go to Canada? For a trip, a site visit? So, well, that ends the, oh, no, wait, it does not. We have Matt. That ends this part. Yeah.
Same. Thank you all. This ends the panel, and we have one more, the last witness of the day, Mr. Celentano.
Madam Chair, members of the Senate Finance Committee, Matt Celentano here today on behalf of the League of Life and Health Insurers and AHIP in respectful opposition to Senate Bill 989. I agreed with about 97% of what Senator Lamb had to say on this bill. I just don't agree with the mechanism. We completely understand why this bill was introduced and would never suggest that these life-saving drugs should not be more affordable, but this approach will do nothing but give the manufacturers free rein to charge carriers whatever they want and increase everyone's premiums. I know this on a personal level because I have a pretty severe bee allergy and I have injected myself with an EpiPen more than a few times. But we shouldn't need to cap drug prices. Pharma should just decrease the prices, especially in EpiPens. Senator Lamb said, highlighted it really quickly. There has been, this drug was brought to the market and has had no new research and development in over 40 years. The only thing that has changed is that they have skyrocketed the price. Once again, no new research and development, no oversight or control on what they charge, and they have jacked the price. It's simply excessive and unreasonable drug prices is why we're here today. The carriers believe that EpiPens, along with some of the poster children for high drug prices like Narcan and insulin, are the exact reason why we should not pass this bill and have the Prescription Drug Affordability Board look at it. They were created to look at drugs that created a significant financial burden, which is what you just heard from the proponents. We want the PDAB to take a closer look at this bill. Copay caps are an imperfect solution to high prescription costs. Decreasing the price of a drug for some insurance members just means increasing premiums to others. A cap doesn't lower the list price of the drug, so everybody else has to pick up the difference. I also want to note that the copay cap creates other problems because the vast majority of carriers are already underneath that $60 copay. If you set a price, you're taking away all the leverage to continue for the carriers to negotiate with pharma, and that, and amongst some other reasons, I'd urge an unfavorable report.
Thank you. Do we have any questions for this witness? Thank you very much. That ends the hearing on this bill and ends our hearings for the day. Thank you, committee.